Yes. So writing, OET writing task. Forget about your profession. I'm talking about the general things. I'm talking about the general aspects. Yeah. I'm talking about the general aspects. Okay. So make notes of everything. I'll see that we will conclude within 60 minutes. And if students are interested, then I will go and explain one type of letter at least. If they are still interested, I'll give another type of letter. Okay. There is no confusion. Right. So not another type of letter, one letter only, but I'll talk about different things like organization, relevance, grammar, vocabulary. Only one letter I'll cover, but I'll go into deeper. Yeah. So, right. So Syed Farhan is a doctor. He's very serious and he knows the importance of this lecture. And in the same way, Safuratu, she's also a regular student and she's also very interested, hardworking. Okay, she has registered with us, so she knows the importance. Who is this iPhone? Whenever you join inside, okay, you will save my 1 minute if you come with your name. iPhone, can I know your name? Please. Okay, Jacqueline, very good, Jacqueline. Yes, you have to come with your name like this. Thank you very much. So first name and second name also you can use every time. So Jacqueline Aggemang. So whatever it is, you type of full name so that it will be very easy for me to recall. Yeah. So because I have two or three Jacquelines I taught earlier. So no problem. I'll remember immediately. So first name and second name. Very good. So we are going to take the points. So now let us see the first one. Make notes, all of you. Make notes. I'll also give you parallel information. Okay. I'll give you parallel information. I'll give you the presentation also. So, because this is a direct lecture, you can see me. So, now we are going to deal with OET writing. OET writing test. Or you can say OET writing subtest. So, OET writing subtest. We have three different components. The first one is the referral letter. Make notes, all of you. The first one is the referral letter. The second one is the discharge letter. The second one is the discharge letter. And the third one is the transfer letter. Referral letter, the discharge letter, and the transfer letter. So we have three different types of letters. We have three different types of letters. Now, and there are in addition some other types of letters also, like providing information regarding an epidemic or passing on general information regarding some guidelines. Many other things are there that will not bother that much. The main are these three: referral letter, discharge letter, and transfer letter. These are the three main types of letters. And on the other way, this is general types of letters. On the other way, there are two more types of letters. Okay, this is based on the intensity of the situation. Based on the intensity, the first type of letter is the urgent letter. Urgent letter or emergency letter. Then the second one is normal letter. Normal letter. Now, what do you mean by urgent letter and what do you mean by normal letter? Urgent letter means you will find some words like this: ambulance, emergency, immediately, spontaneous. Make notes, all these things. Okay, make notes and afterwards send the notes to me. I'll put all the others notes also, so that if you miss anything, others notes you can take and make a quality notes, because I cannot type everything, right? So I'll be telling number of things. Make notes. So it is based on the urgency, immediately, accident, emergency, A&E department, accident and emergency department. So if such a thing, such words are there, that means that this is an urgent letter. A letter talks about urgency. If these words are not there, it's a normal letter. Now, what are you going to do with regard? I will talk about each and everything regarding these things in individual sessions in detail. How to handle urgent letter, how to handle a normal letter, how to do the discharge letter, how to do the transfer letter, how to write a referral letter. Everything when we go personalizing the letters, I'll discuss with you. Now, this is a general basic information. General basic information. So, no need to panic. So now I will give you general idea regarding all these different types today. Overview of these all these things. Now, urgent letter means brought in by sent by ambulance or brought in by ambulance. So urgent letter will not be a discharge letter. Okay, it will be an emergency referral or an emergency transfer from a normal hospital to a super specialty hospital, because the case is urgent. So something serious thing has come. So you're transferring this patient to a higher level hospital. So you're transferring this patient from a normal hospital to a super specialty hospital. Or you are referring from a town to a city hospital, multidisciplinary hospital, you are referring. Or you are referring as a physician to a surgeon or to a physiotherapist. So you are referring for a higher level. You are a general physician, you are referring to a surgeon or a specialist like a cardiologist. You know that there is something serious and you cannot handle it. So you are referring it to a cardiologist who you know, the patient doesn't know. That is a referral letter. Referral letter means, referral letter may be urgent letter or ordinary letter, depending on the situation. That is a different type. Urgent and ordinary is a different type. Now, referral letter means you have a patient, you have been handling his case for quite some time, or today itself he came here, and you know that it is beyond your capacity to manage his condition. It is out of your scope. It is out of your scope. It is beyond your reason. It is beyond your ability. You cannot handle this particular patient because you are a general physician. You are not a specialist. He has a hole in his heart, or he is burnt. And the burns are multiple degree burns. First degree burns, second degree burns, and third degree burns also. Mixed burns. Superficial, medial, and depth. Epiderm, superficial.
mesoderm, middle level, endoderm, lower level. So the burns went deep. And not only that, they affected the bones also. Now what you can do it? Is superficial, you can do something you can handle. Now this is not, it's beyond your capacity. And now, therefore, you cannot take the risk. It is beyond your purview, it's beyond your scope. So you will transfer. No, you are referring him. You are referring him to a specialist, skin specialist, or burns specialist, burns specialist, or skin specialist. Okay, try to understand this one. We call them as the dermatologist. Okay, he's a specialist with regarding to skin, maybe. So we are referring to that particular person because you know that you cannot handle this situation. It is beyond your ability. So you have to pass on the responsibility to somebody else, or you have to face the consequences. You will have to face the consequence. Tomorrow he will tell that you did not take care of him. Okay. Now what is your role? You have to diagnose his condition. Maybe you can diagnose or you cannot diagnose. Preliminary diagnosis or confirmed diagnosis. You can confirm the diagnosis, or you are not even aware of the confirmation of the diagnosis. The signs and symptoms say something different, but you are not perfect to diagnose the patient. He has some heart problems, and you are not a specialist. You feel these symptoms are related to heart. So you will get a preliminary diagnosis. Something problem is there in the heart. Then you will refer him to a cardiologist. Something problem is there in his brain. You will refer him to a craniologist. Okay. Something problem is there in his lung. You will refer him to a pulmonologist. Something problem is there in the skin. You will refer him to a dermatologist, oncologist, neurologist. You know, I don't need to tell all these things what they are specialists for. Podiatrist, physiotherapist, ophthalmologist. So a general physician can handle all these levels to a certain extent only. All these areas, a physician, a GP can definitely handle to a certain extent only, a limited extent. Once it crosses the boundary of his, he is helpless. Now, as a doctor, it is his responsibility to guide this particular patient in the most appropriate way. Because the patient doesn't know anything, he just trusts you. Now, it is your responsibility to do all the tests, whatever possible. And only if you can handle him properly, you can continue. Once you believe that it is beyond your reason, knowledge, understanding, power, and scope, it is your responsibility to transfer this responsibility to somebody else powerful. Okay? So now the patient doesn't know where he has to go or to where you are going to send him. I'm going to the depth of the points. Okay. So now, what is the referral letter? We'll see later. How to write a letter, referral letter? What are the components of the letter? All these things afterwards. But what is the referral letter? We should know. Now you know that there is something problem with his heart. Then you will send him to a multi-speciality hospital. Directly you will refer to the hospital itself, number one. Because you don't know what exactly his problem is. There they will do all the tests and they will direct them from there to a particular department. That is number one. When you don't know to which specialty you have to send, that's it. You don't know. So you'll send him directly to a multi-specialty. You'll send to a hospital, not to a specialist. When you know that this is the problem, 75 and more than that, then you will directly refer to that particular cardiologist. You know, directly to the cardiologist. Because you almost the signs and symptoms show that. Then if that is not right, then he will check there and he will send it to, no, this is not related to heart. This is something else, he will tell. Then he will refer to somebody else. The right direction should go. Okay. Then, now this is called a referral letter. Because the patient doesn't know where he is going, but you know where he is going. And who is going to treat them? What is the name of the hospital? Everything you know, but the patient doesn't know. So you are introducing this patient to another specialist. That is a referral letter. That is a referral letter. Okay. So referral letter is going upwards. Upwards from ordinary level to a higher level. Referral letter will go from a lower level to a higher level. A nurse will refer to a doctor. A nurse will refer to somebody else. Or a doctor will refer to a specialist. Or a more experienced doctor. Or a doctor will refer to a physiotherapist. A doctor will refer to specialist, na? Podiatrist, ophthalmologist. They are specialists. A doctor is not a specialist. Is a general practitioner, general physician, normal doctor. Is not a specialist there. Remember that. So a normal doctor, general physician, or a general practitioner to somebody specialist. Because no patient knows where to go. So he'll directly go to the doctor only. Right. Remember that. So referral letter is going to a higher level. Okay. Which you cannot handle. You're sending it to a number one. Number two, transfer letter. Now, transfer letter is from one facility to another facility. Transfer letter is from one facility to another facility. Yeah, before that one, urgent referral and ordinary referral. Let us finish those things first, referral. So, urgent letter, patient came to you, you are treating him. Today only he came, but you find that he has serious problem now. And you cannot handle it. And you don't know what is happening. Nothing is going to give you any idea. Then immediately you will refer him. That is called urgent referral. Because if you are delaying, the problem will be there and his life may be at risk or the condition may deteriorate. So emergency basis, you will call an ambulance and you will arrange a facility and you will send him immediately. That is an emergency letter. You will not retain him even for 1 hour, even for 10 minutes. The minute you know that it is a problem, you will be in a panic and you want to send him away from your place because you will be questioned afterwards. That is the urgent letter. Ordinary letter. You will be treating him, okay, on the first day, and you will ask him to come the next week, then another next week, then after 2 3 weeks, or maybe second visit or third visit or fourth visit, or after 10 visits, then you understand that it's not going to happen anyway. So what we gave all the treatments, and now I don't understand really what it is happening, so I'm referring to some special, I'm really not able to digest, so I tried all my best. So that is a normal referral. So referral is finished. Now transfer letter. Transfer letter. Urgent transfer and ordinary transfer. Urgent transfer will be again, okay, from lower level to higher level, because here we are not able to do anything. So we are sending to a higher level where better equipment, better doctors, better specialties, everyone is there. So that is urgent transfer. Okay. Now transfer letter will be 75%. Transfer letter will be 75% normal, and reference will be for seriousness. Transfer will be for normalcy. So 25% only urgent transfers, and 75% will be normal transfers. So transfer will be from higher level hospital to the lower level hospital, because this is a specialty hospital and more special cases are there, emergency cases are there, important cases are there, serious cases are there. Those we will handle and keep them there, and those who have recovered 50% or 75% or 25%, we will pass them on to the lower level hospitals for follow-up care, because his urgency is removed now. The condition is no more urgent. There is no more emergency. Seriousness is removed, and he has come to a normal state. His risk is removed, lessened, and everything is fine now. So that is how you will send them to a lower level hospitals or parallel level. Okay, parallel, same level or lower level. So that is a transfer letter. That is a transfer letter. So it may be even to a care home. Transfer letter will be to care home, because he is not the, that is not the ultimate destination for him. It is not the ultimate destination. It is the penultimate destination. It's not the final destination, because first he will go to care home, and there they will take it. So they will take care until he recovers 90 to 100% or 80% to 100%. After that, they will go to home. That is the final. So transfer letter is not to the lowest level again. It's same level or little lower level. So it may be to another hospital, from higher level to next level. So intensive care unit to normal unit, general ward. From general ward in a super specialty hospital to a district hospital. From district hospital to village hospital. From village hospital to the general practitioner's personal clinic. Okay. Or to a care home, or some support facilities, rehabilitation centers. So whatever it is, so some other facilities. These are not the final destination. So that is a discharge letter, transfer letter. And a discharge letter means we are discharging him. He is totally recovered, number one, or in the total recovery stage. Now he doesn't need any support, or some normal support somebody can give him at home. Or it may be to a care home also, if he is living in the care home. Okay. Residence, old age care home, maybe. Or nobody is there. So he is staying in that rehabilitation care, old age facility. The final destination will be discharge letter. final destination will be discharge letter. Discharge letter means a person who is discharged is going to his final destination. Okay. Transfer is also discharge, but he's going from this hospital to another hospital or another care home. But discharge letter is also transfer letter, but it is going to the final destination. Don't get confused here. A discharge letter is going to the final destination. That means he is going finally to his home. From where he came, there only he is going. Back to the pavilion. From where did he come to the hospital? He came from home. So he is going back home. He came from care home. So he is going back to care home. Because he lives there. He has been living there for 2 years, 3 years, 4 years. He will go there only because it is his final destination. He had nowhere else to go. This is the last destination for him. That is a discharge letter. Try to understand the points very, very clearly. Am I clear to you? Just message me. Have I clarified you what is an urgent letter and what is an ordinary letter? Have I clarified to you what is a transfer letter, what is an discharge letter, and what is a referral letter? Have I clarified it to you? Yeah. Give it whether clarify me. If you are understood, say yes. Right. What about others? Yeah. Now coming to the point. I'm talking about general things, okay? I'm talking about general things. You have to make the notes. You have to make the notes. Yeah. Next one. So we have seen types of letters. Then we have seen urgent and ordinary types of letters. Now we are going to see the components of the letters. There are 7 components. 7 components. Write down. 7 components of any letter. 7 components of any letter. Make the notes, all of you. I'll tell you. I'm not talking about referral letter. I'm not talking about discharge letter. I'm not talking about transfer letter. I'm not talking about urgent letter. I'm not talking about ordinary. I'm just talking about general things which is fits everything. Okay. Very, very important things. So the first one is the address. The first one is the address. Write down. Now, what is this address? Okay. What is this address? Yeah, first point 1.1. 1.1. Now, what is this 1.1? 1.1 is the name of the receiver. Yeah. 1.1. This is the name of the receiver. It is the name of the receiver. Write down, make notes. If I make notes, you will be silent. Afterwards, you will not do anything. I know. That's why I'm giving you the lesson. You make the notes yourself so that it will be stored in your brain forever. Yeah. I don't want you to make too many mistakes. Then afterwards, you come to me, I will get too many corrections. Why? Why I should correct all your little nonsense things? Before only I'll train you properly so that you will not do any mistakes. Which do you feel better? You will make too many mistakes, you will not learn properly, you will make too many mistakes, and you will write the letters and all that nonsense I have to correct. Do you think is that the right way? Or I'll teach you everything perfectly, then you'll write everything perfectly, then I'll say, oh, very excellent. No corrections, less corrections. Which is better? Now you decide. So that's what I'm doing now. Number 1.2. All these things, make notes, okay? 1.2. Now this 1.2 is the designation. It is the designation. Designation means doctor or physician or cardiologist or ward nurse or aged care nurse or community nurse or physiotherapist or cardiologist. What is his designation? The second one is his designation. Make a notes of these things. Yeah, designation. Next one is 1.3. 1.3 is the department. Department. You'll write about the department. 1.3 is the department. Everything may be there, everything may not be there. What is there, you write. What is not there, leave it. For example, name of the doctor is given, write the name of the doctor. If the name is not given, don't write the name of the doctor. Department is given, write the name of the department. If the department is not given, don't write the name of the department. That's it. It's not necessary that you have to write all these things. What is provided, write that. So, name of the receiver, the designation, the department, and number 4, 1.4. 1.4 is the name of the hospital, name of the facility, or hospital, or clinic. Whatever it is, the name of the facility or hospital or clinic, you will write the name of that one. It's in an order you will go. 1.4 is the name of the facility. King George Hospital, Newtown Surgery, old age care, we care, old age home, King, okay, Senior Kennedy Mental Rehabilitation Center, whatever it is, name of the facility, you have to write that. That is 1.4. Make notes. Afterwards, I'll not explain all these things. I'll just go into the subject. Yeah. 1.5 is the name of the street. Street name is not given, don't write. Street name is given, write. Whatever is given, write. Whatever is not given, leave. Is the name of the street. 1.6, the name of the village or city or town. 1.6 is the village or town or city. Many people don't write everything, but you don't know everything. Whatever is there, you have to write. They also have some marks. You don't know. You think only the body of the letter will be evaluated. No, that is important, but the other things are also important. If you don't write, you will get the marks cut. Then 1.7, it is the state. Like ON means Ontario. ON means Ontario. Name of the state will be there. AK, Arkansas. Okay. So the name of the state will be there. We'll see those things later. All the names, how they will be spelt and all the things. Okay. Sometimes they write ST, means a street. You have to change it into street and write. Sometimes they'll say RD, that means road. You have to change it into road and write. RD is given, you are writing RD. What is the meaning of writing then? Don't write. TCE. TCE means what? It is a terrace. TERRACE, terrace. So, short forms should be made full forms. Expand the case notes to give a full picture. This is a formal letter. It is not a letter to your friend or a relative. It's not a social letter. It's a formal letter. It's an official letter. You will be punished. You will lose your marks for that purpose. I'm teaching you because it's very important. Now here, Dr. Syed Farhan Ahmed is there. He's a doctor. He will not miss the session from the beginning to the ending. Why? Because he knows that it's important. You know, he took leave and he's studying. Why? Because this is important for him. Totally dedicated to only study. When you want something, you should be behind that. Yesterday, I took 4 hours class. He was there from the beginning to the ending. Nishanti, she was there from the beginning to the ending. Those people who are suffering knows the value of these classes. I'm not mad to give all these explanation here. I just can leave like that one. I'm not like that. I want to make you perfect. 1.8. The country. The name of the country. Okay. The name of the country. And number 9, 1.9. The pin code. There will be a pin code, country code or taste code, or every place has a pin code. If it is given, you write. If it is not given, you leave. They'll give. In India, it is 6 digits with a space between 3 and 3. For example, Hyderabad 500 space 001. So the 3 plus space 3, like that. In some countries, it will be 4 digits, 5346, like that. In some countries, with the name 53K06N, like that one. Sometimes letters and words will be there together. Letters and digits will be together. Write them as it is. If space is there, write with space. If space is not there, write without space. In the address, every word, the first letter should be capital letter. See, important information I am giving. I'm not talking about referral letter. I'm not talking about urgent letter. I'm not talking about transfer letter or discharge letter. I'm talking every letter in general. This is a general class. This is a basic class. Whatever I'm teaching now, I will not teach in other lectures. So, write the pin code. Whatever is given, you give, write as it is. Don't miss them. This is component number 1. Component number 1 is the address. Jacqueline, Krishna, Nishanti, Safuratu, Tandika, Syed Farhan. If you want to send this link to your friends, you can send them. If you feel that. Because regular students are not coming. Those who paid the fees, they are not attending the session. You can give them freely to somebody else, no problem. One session, I'll not give all the sessions to anybody. Na? I will block them. If they are attending regularly, I'll block them. I'll not attend them. Allow them to attend. Let them come as a demo. If anybody wants to learn, let them come in. Yeah. People don't know the value of these classes. They are not coming, still our regular students. You can invite your friends, those whom you love. Okay. You know, you paid some fees, 10 times more I will give you. So you bless others. Okay, maybe one person wants to join our class. That will benefit our institute. I don't need anybody. Our institute needs students to get more name. Yeah. So, this is the first component. Next component number 2. So 1.1, 1.2, 1.6 we finished. Now 2. So second component is the date. Second component is the date. Many people will write a date in the beginning, before the address. But don't write before the address. Some people say write it before the address. And some people say, no problem, anywhere you write. I will not tell you anything. I'll tell you, apply your common sense. Will you listen to these people who say write the date before the address? First write the date and then the address. And some people say first write the date and then the address. And some people say write the address first and then the date. And some people say, the third type of people say you write wherever you want, first or second, no problem. They say before or after the address, you can write the date. They say this is the third type of people. But I don't belong to these three types of people, because you are matured enough. You should know what it is right and what it is wrong. Now, how do you know what it is right? Any individual, even Simon sir, don't believe me. I never say I am Simon sir, I am masters, I am doctorate, I am a PhD, I did my training. I'm not telling all those things. Don't believe me. Then who should we believe, sir? How do we know what to believe? You know which test you are writing? OET. Then whom should you believe? OET. All the information is there in the OET. Take any official material, authentic material, OET online, OET original version books, not any other publisher. OET only. Only OET. There you see, 5 official samples are there in official OET. Teacher's handbook is there, OET. And there is one book, official study material for all the professional, nursing, doctors, everything. In all the official books, you'll find. Follow that one. Okay. I'll show you one material only for each one when I take the lecture. In the meantime, you can see online materials I'm sending you. From those you can see. First, the address is there, then the date is there. So follow OET. I'm not telling you. If you want, that's up to you, your decision. Suggestions are mine, decisions are yours. So the date. Now, date, there are some important things. 2.1. 2.1 is the day. So the date. 2.1 is the date. So this date will be 1 to 31. 1 to 31. You can write 1 or you can write 0, 1. But 0 doesn't help anyway. If you write, it's okay. If you don't write, it's okay. No problem. 1 to 31. So this is the date. Then number 2.2 is the month. 2.2 is the month. Now 2.2 is the month. Now many people will write 1, 2, 3, 4, 5 to 12. So 1 to 12 they will write. 1 to 12. Okay. But I tell you, don't use these things. Don't use 1/5 means 5 means May. So 1/5/2094. Okay. 1/5. 5 means May, no, sir. So I'm writing 5. Now there is a contradiction. In India, 1/5 means 1st of May. But in America, 1/5 means it's January 5th. Because in some countries, they write month first, and in some countries, they write month second. There is no guarantee in certain cases. That's a problem. So there is a standard version called writing the month in words. So that is what I recommend, because OET is also following the same pattern. OET will not write the month in word digits. You see, in the I'm talking about the date, not in the middle of the letter, in the beginning, after the address. They always write. So, for example, May, they will write MAY. Okay. Or September. So, 2 are enough. So, it is from January to December. 12 only will be there. January to December, 12 only will be there. Yeah. You may think we know all these things, but you don't know many things which I have told you. Okay. Maybe knowing. We know the date, how to write. Yeah, you know. But why you should write like this, why you should not write like this, you should know. You can refer to the official OET question papers for a better understanding. Don't believe me? Go and check and cross check. Then you will get more confidence on me. Now you have 100%, then you will have 200%. Okay? Right. So September. Then next one, number 3. 2.3 is the year. The year. Now, how will you write the year? 4 digits. Don't write 2 digits. Many people will put single stroke inverted comma and the last 2 digits. 2024. Instead of writing that, they'll put an inverted comma and write 24. Don't put like that. That's the full 4 digits. 2024. So the complete date will be like this. So today's date is 10th, 10, and the year month is December 2024. Yeah. This is the perfect way. And the D should be capital letter. First letter should be capital letter. Any name of the month, any name of the day, Saturday, Sunday, Monday, Tuesday. I'm teaching you rules. When you're doing reading, when you're doing listening, this work, sometimes Wednesday will come. What will you do? Many people will write WED, means Wednesday. Oh, I wrote, no, sir, WED, I wrote. That means Wednesday. Huh? Correct? Okay, Wednesday is correct, but is it Wednesday? Madness, craziness, idiocy, foolishness, ignorance, lack of common sense, not applying the facts, unreasonable attitude. All these are cut off because OET will not spare them. OET will not spare them. Remember that. Okay? Don't take it for granted. WED, I'll write every time like this. OET is not you, and you are not OET. You have to rise up to OET to get the mark. That's all. What it wants, you have to give like that one. Even a small child will not accept. Okay? Until he wants that one. He will start crying. If he says, Papa, play with me. Mama, play with me. And if you don't play, he will cry. Until you play with him, he will not stop. So better play with him so that he will not cry. In the same way, when small boy only cannot accept, okay, how will OET accept you? No way. He deserves his time. He deserves his quality. That's it. OET ultimate. Next one. This is aspect number 2. Aspect number 2. Yeah. That is aspect number 2. Next one. So this is how it is. And when you are transferring from point number 1 to point number 2, leave one line. There are many things which I tell you, whatever notes, I cannot write everything. You write down. Capital letter. Why should I write capital letter? For December, January, I should write capital letter that we have learned in 5th class only. But make it a rule. Many people don't write. If you don't write a capital letter for D, or you will write a DEC, you will lose marks there. If you are clever and you will write it, that's good. Well and good. I'm not talking for the cleverest people. Okay. I'm teaching everything so that you will not do any sort of mistakes. I don't know, which you know, which you don't know. I don't know. So I'm teaching you everything here. Yes. Next one. One component to another component, there should be one line left. Dr. Syed Farhan, make a good notes of this. Huh? I know you are very, very obedient as a doctor. So you'll make notes and give that notes to me so that I can give to others. Because others may doubt because many students, okay, they will all make notes. But I know you will think, because I'm giving responsibility to you. So you will see the care that everything is pointed down. We'll make some rules for everyone for writing a letter. So between address and the date, leave one line space. Leave one line space. For others, no less, no space. First line, second line, third line, fourth line, fifth line, 5 lines, you write no space. But after the address, you leave one line. But that means every component, you are shifting from first component to the second component, leave one line. Second component to the third component, leave one line. So next, number three. Number three. I finished. I told one thing, what I told, or difference between basic ideas I gave. Now I'm going into the depth. Okay, I'm going into the depth. So those who are interested, you can continue staying. Those who are not interested, you can leave if, according to your wish. But it's a very important lesson. Okay, I won't force you because I'm giving a personal lecture here to satisfy myself, not to satisfy you. Okay, I'm going into the depth of the subject to make myself happy. Right? Yeah. So number three is, okay, the salutation. The salutation. The salutation. Number three is the salutation. Now, what is the salutation? So when you go and meet somebody, you say, hello, good morning, how are you? You are saluting him. You're giving salutation, means greetings. You'll say, dear doctor, hello doctor, like that. Something you are doing there. So the salutation. Now the salutation will be of two different types. One is when you know a person, and one is when you don't know the person. When you know the name of a person, when you don't know the name of the person. When you know the name of the person, you will know the name of the person in the beginning. First line is there. The name of the recipient. The name of the recipient is Mr. Abraham Lincoln. So if the name of the person in the first line in the address, this is related to the first line in the address, 1.1. If it is there, Mr. Okay, or Dr. Abraham Lincoln. If it is like this, 1.1 is Dr. Abraham Lincoln. It may be like that. Okay. Then 3.1, 3.1, that's all, 3 only. Yeah. Okay, it's just a 3. So 3 will be like this. Okay. So 3.0 we can say. There's only one thing is there. 3.0 will be like, dear Dr. Lincoln, comma. So if 1.1, the first line, the very first line is Dr. Abraham Lincoln. So you are writing to Dr. Abraham Lincoln. You are writing the letter to Dr. Abraham Lincoln. Remember that. That means personally to Dr. Abraham Lincoln. Then it will be personally salutation. Dear Dr. Lincoln. Dear Dr. Lincoln. Sometimes 1.1 will not be the name of the person. Okay. It may be the registrar. It may be the registrar. Okay. If 1.1 is the registrar, okay, then 3.0 will be, or the salutation will be, dear registrar, comma. Or you can also write, dear doctor. because registrars will be doctors only. Doctor only will be registrar. Doctor only will be the head of the department. Doctor only will be the dean. In a medical college, medical hospital, medical everything, everyone is a doctor only. Only doctors. So directly you can say doctor, dear doctor. Okay. Department head, doctor. Dean, doctor. The in charge, doctor. So you can directly write the dear registrar or dear doctor, or you can also say 3.0, dear sir or madam, if you don't know. So dear registrar, dear doctor, dear sir or madam. You can use, make notes, make notes. Yeah. So this is how you will write. If the name is given, then write the second name. Don't write the first name. Dr. Abraham Lincoln is in the address. It is in the address. But in the salutation, you will write only the second name. Don't write the first name. It is a wrong. It's a mistake. It is not right. It is incorrect. It is inappropriate. Dear Dr. Lincoln. That's it. If the name is given, dear Dr. Lincoln. Okay. Right. Remember that. So this is 3.0. Name is given. You will write dear, D capital letter or small letter, dear Dr. Lincoln. Okay. Dear cardiologist. Cardiologist also a doctor. So you can say dear doctor, finished. Because in the beginning only you said cardiologist, no? So dear doctor, enough. Salutation, be specific. Okay, be specific. No need to say cardiologist. For cardiologist also, you'll say doctor. Ah, doctor. Okay, doctor, you will say. You will not say, okay, the cardiologist. Okay, pharmacist. Okay, physiotherapist. You will not say like that. You'll say, dear doctor. If he's a doctor, he's a doctor. That's all. So you'll say, okay, doctor. We'll not bother with, okay, surgeon. No, okay, doctor. Try to understand that one. Okay, dear doctor. Finished. If the name is given, then doctors shorten that one, DR. And dear Dr. Lincoln, DR, not a DOCTOR, doctor, DR. Remember that. So that is 3.0. Next one, fourth point is we call this as the reference. The reference. So this is regarding what? Or you can also say the regarding line. Okay. Or you can say the subject of the letter, why you are writing the letter, the subject. About whom? The subject of the letter. To whom you are writing. Okay. The subject of the letter. Now there you will write, first you will write R capital letter and E small letter. And then you will put a colon. Okay. Like this. R capital letter, E small letter, and immediately colon. Many people, after E, they leave a little space. No, don't leave any space. It's a mistake. It's a grammatical error. It's a grammatical error. So the regarding RE colon must be there. Then afterwards, you are writing about a particular patient. You are writing about a particular patient. So you will write the second one. That is, okay, number 1. So 4.1 is our E colon. Yeah. Then 4.2, it is not in the next line, it is in the same line. But points I am telling you. 4.2 is the name of the patient. The name of the patient. So the name of the patient will be like this. Mr. No need full stop, no need comma. It is accepted nowadays. No need to put full stop for Mr. Doctor, every line. No need. Okay. So Mr. You can say Mr. Yeah. Steve Parker. Steve Parker and put a comma. That is 4.2. Mr. Steve Parker. Okay. Then 4.3 is the date of birth, colon. Date of birth, DOB. No need full stop, full stop, full stop. Date of birth, DOB. When it is capital, no need to put full stops. Some people write D, full stop O, full stop B. No, DOB, that's enough. Date of birth. Then 4.4 will be the date of birth in full. Okay. The date of birth in full. Or 4.5. There is another component called age. There is another component called age. Sometimes date of birth will be given, sometimes age will be given. If date of birth is given, write a date of birth. If age is given, write age. So 4.6 is, so the year, age 46 or 54. So that's it. So sometimes age is given, write age. But if both date of birth and age both are given, write date of birth. Date of birth is given, age is given, two are given, write date of birth. If only date of birth is given, write date of birth. If only age is given, write age. If both the date of birth and age are given, write date of birth. Don't write age, because date of birth is more specific than age. Okay, that's very important. So both given. So let us take this as 4.7. Both given. Both are given. Then what you have to do? Write. Okay, what? Date of birth. That's it. Both are given. Sorry, I made a mistake. N is lost there. Both are given. Write date of birth. So this is component number 4. Now in full, how will you write? Now let us see. Regarding R capital E small colon, then space. R capital letter. Write in your notebook when I am teaching. Nah? Write in your notebook. Make it a practice. R capital E small letter. Immediately colon, no space. Before colon. R, E, colon, then space. Single letter space. One letter space. Then Mr. No need full stop. Space. Steve Parker. Mr. Space. M capital letter, R small letter. Steve Parker, comma, date of birth capital letters, colon, space. 12 January 1974. So that's it. So this is how you're going to write. Regarding R capital letter, E small letter, colon, Mr. M capital letter, R small letter, no need of full stop. Steve, S capital letter, Steve, space, P capital letter. That means every word, first letter should be capital letters. Remember that. That's a fundamental rule. Don't break that rule. Steve, S capital letter. Parker, P capital letter. Immediately comma. No space before comma. Many people write space before comma. I don't know why. I don't know why. Then DOB, single letter space. DOB, immediately colon. Many people don't know this rule. I show you. In my corrections, you can see. Okay, I'll put a blue line under that one. Many letters like that. Then 12 January 1974. So if date of birth is given in two conditions, only date of birth is given or date of birth plus date are given. Both are given or only date of, you have to write date of birth only like this. If date of birth is not given, then how you are to write regarding Mr. Steve Parker, everything will be the same. Instead of date of birth, you will put comma there, space, and aged. No capital letter. Don't put capital letter. Aged, how much? 74, 84, 94, 04, 14, 24. So 50. Everything is same. Remove date of birth. No capital letter. Aged, a small letter. 50. DOB we put capital letters because each letter is a word actually. D means date, O means of, B means birth. That's why we put capital letters because they are acronyms or abbreviations. But aged is not an acronym or abbreviation. Every letter is not a word. It's one word in itself. In date of birth, there are three words, but here aged is only one word. So you cannot write capital letters. And 50. That's it. No colon, nothing else is needed. So these are the two ways you have to write. And other than that, there are some other things we have to consider. What is that? 4.7 over 4.8. These are points actually. 4.8. 4.8 is, suppose if this is a lady, if it's a man, you are writing Mr. That's it. If it's a man, means above 18 years of age, you will write Mr. So, Mr. for men above, these are all points, make notes, 18 years of age. No, 18 and above. Men of 18 years and above 18 years of age. That is better. Mr. You will write for men who are 18 and above. For 17 years, 11 months. Somebody came, Regina. Yeah. Yeah. So here, you see here very carefully. Below 18 years, even one day below also not Mr. Remember that. At least 18 years and above, you will write Mr. Then if it is not 18 years, then what we should do, sir? Don't write anything. Don't write anything. That's it. Just write the name. Abraham Lincoln, Steve Parker. That's all. Don't write anything. I'm talking about subject line, not in the body. You did not go to the body yet. You have to write the full name of the patient. So write full name. If he is above 18 years of age, write Mr. Steve Parker. If Steve Parker is 17 years or 16 years or 15 years or 14 years or even 2 months, just write a Steve Parker. That's it. Be careful. I'm very clearly telling you. Again, when I'm going into the letters, I will not tell all these things. Okay, I don't want any mistakes there. That's why I'm explaining so much here. Right. Then 4.9. So 4.9. 4.9 men, not men. Okay. They're not men. So they are. So just we'll write male persons. So I cannot say men. So male persons. Okay. That means children. Let us consider that. Male persons below 18, not 18, below 18 years of age. Then what you will say? Just the name. No title. No title. No title. Don't give them title. Okay. No title at all. Just the name. What you'll say? Steve Parker's or Abraham Lincoln. Finished. Okay. Without title. So Steve Parker. Finished. This is for men. We finished for men now. Male. Male finished. Now females. There's a complication for females here. Little, little critical here. Now, first and foremost, if you know that she is an adult, above 18 years of age, 4.10. 4.10. So, this is for females above 18 and married. For men, no use married or men non-married, that is the same. But for females, if they are married only, this condition apply. Okay. If they are married, you will say Mrs. 1 minute, please. Yeah. So for 4.10, females above 18 and married. We have to be very careful with females here. Okay. Right. There are some restrictions which you should be very careful. Males, it's very simple. Men above 18, 18 and above or below. Men above 18, 18 and above, Mr. Otherwise, just leave it. No Mr. That's all. It's the same other things. But females above 18, 18 and above. And if they are married only, then you will say Mrs. Mrs. Steve Parker. Mrs. Lydia Parker. Mrs. Lydia Parker. So that we will do. Mrs. Lydia Parker. Regarding Mrs. Lydia Parker. Now here you understand that she is a lady and she is married. Because everyone, many people do these mistakes. Be careful. 10 marks you'll lose. Be very careful here. You'll definitely lose 10 marks if you make a mistake. You don't understand the case notes properly. So if it is married, Mrs. And in marriage, remember that. Married. She is married. And in marriage, you will say Mrs. If she divorced or separated or complicated, that is different. Husband passed away, that is different. Married and in marriage. That marriage is existing. Okay. She is married and marriage is still existing in marriage. Okay. So then you'll say Mrs. And for example, next one, 18 and above. 18 and above, not married. Then what you will say? This is 4.11. These are all conditions. Okay. 4.11. Okay. So females females 18 and above and not married, then you will say Miss. Miss. This lady's name said Miss Cynthia. Okay. Miss Cynthia. Cynthia is the name of a small girl, one pastor's daughter. I remember. So I just Miss Cynthia Parker. Miss Cynthia Parker. So this is above 18 years of age, but she's not married. Then you'll say Miss Cynthia Parker. That means you understand that she is above 18 years of age, number one. And the condition is she's unmarried. She is unmarried. That's the point. Above 18 years of age, and you know that she is unmarried, then you can say Miss Cynthia Parker. No, sorry. I got confused. 1 minute, 1 minute. 1 minute. That's delete. No. It is Miss, MISS. Miss Cynthia Parker. See, I also slipped a little. Miss Cynthia Parker. Miss Cynthia Parker. Miss. This shows that she is unmarried. MISS. Miss means unmarried. Okay. Rectify that one. Rectify that one. If you had already made a notes, rectify that one. Miss Cynthia Parker. Miss Cynthia Parker. And now, the third category is divorced, separated, or husband no more, or any sort of other complicated situations. For example, live-in relationship, or what all sort of relationships are there, and such things are there. Okay, boyfriend, they call different labels. Okay, one is married and above 18, one is unmarried and above 18. Those are 5. All other categories. So she is living with one boyfriend, and this boyfriend is not the father of this child. Like that, a lot of relations we get, and lot of letters we'll get. So all these sort of distorted relationships, okay, distorted relationships, or relationships which are not perfect. Okay, right? So such relationships you can, or you don't know what type of relationship, then that is the third type of title you give, that is Miss Beatrice Parker. Come on. Yes, Miss MS means all other relationships. So MS stands for no relationship, MRS stands for perfect relationship. For all other imperfect relationships, we'll say MS. We don't know what relationship they are in, or we don't know anything about them, then you should say MS. If you know that she is married and in the relationship, it is MRS. If he is not married, that is MISS. And all others, you write MS. It's a little bit complicated situation. You have to think on your basis, because British people are very careful regarding these titles, especially with MISS and MS. Confusion will be there. Be very careful. If you don't know anything, just write MS. Then next, below 18. Already I told for men. Same thing for ladies also. Women below 18. Not women, we cannot call them girls. Girls below 18. Girls below 18. Just the name. No title. So this is 4.1.
4.12. 4.12. So that's very clear. So how to differentiate the titles, whether we should write the title or not. If below 18 years of age, no title. That's very clear. No title. Now once again, men were above 18 years of age, automatically men. So Mr. MR. Ladies above 18 years of age, 18 and above, not above 18, 18 and above. 18 also included, 18 and above. Married, M capital letter or a small. And who are not married, 18 and above, M capital letter ISS. And all other relationships like improper relationships, divorced, separated, lost husband, and all these things, because they are not in marriage, you cannot call them Mrs. So it is Miss, M capital letter S. Okay, right. So next, remaining things will be the same. Aged or a date of birth, both as it is. I have already shown you. Next, component number 5. So these 4 aspects are called the starters. The starters means we did not start the main course, right? We did not start the meal. So before the meal is the starters. Now, 5th one is the main course. 5th one is the main course. Now, before going to the main course, I want to know whether you have understood all the 4 parts or not. The starters, the main course, and the desserts. So, like when you go to a hotel, 5-star hotel, we go there. Before the main course, there's what starters? You'll give the order for main course. Before the main course, it will take 15 minutes, sir. What do you want? Starters. Yeah, you bring some lemonade, or you some juice, or you bring some, what is that, soup, or French fries, or something else you call starters. Okay, which releases our stomach, which makes us our appetite free. Okay, so that we can be ready for, okay, lunch. So like that one. So now write your comments, whether you have understood or not. Write your points there, please. Write your points. How well you understood. Is there any confusion? Am I clear? Everything perfect or not? How far I was able to explain you? I understood 100%. I understood 50%. I still have little confusion. I did not understand this particular thing, or I came late. Whatever you want to write, you can write, please. Because we are going into the main course. So once I go into the main course, I'll not come back and explain anything before. You can invite your friends if you have any best friends. Yeah, Krishna, don't give me any personal message. Directly send a message in the group itself. Because again, I have to change from Krish iPad. Again, I have to change it to everyone. Because when I send a message, it will come only to you. So don't send any message direct in the personally to me. Direct in the group only. Yeah, Regina. Regina, welcome. You are a guest today. You are free to attend this session because it's a demo session for you. But it's a regular session for all the regular students who have registered course with me. Yeah. You can attend, no problem. I have only invited you. This is your first class, I know that.
so that you can have a taste of our classes. Right. All the others are regular students. Tandeka is a regular student. Farhan Ahmed, doctor, regular student. Sarfuratu, regular student. Nishanti is a regular student. Krishna is a regular student. Jacqueline, day before yesterday, she joined. Day before yesterday. Yeah, day before yesterday, she joined. So, like that. So, they also attended one session. Then afterwards, they joined like that. So, demo session for you. Right. Now, so shall we move on to the main course? The main course. So 4 components: the address, the date, the salutation, and the subject line. These are the 4. These are the starters. Now we are going to the main course. Main course is the body of the letter. The body of the letter. The body of the letter. This is 5. The body of the letter. The main course means the body of the letter. Main course means the body of the letter. So we are going into the main course. This is a very lengthy process, okay? But before going to the main course of the body, I'll go to the deserts. So A is the starters before the body. B is the main course, because main course is very important. Okay. So C is the deserts. Deserts means the conclusion and other things. Deserts, the last one. So last one will be very easy. So let me conclude that one. So we are going to the deserts first. We're going to the deserts first. Now deserts, there are 2. Point number 6. This is called the closing remarks. The closing remarks. 6th one is the closing remarks. The closing remarks means we'll say bye, hi, bye. In between, we'll discuss everything. Hi and bye. So here, the closing remarks 6.1. If you know the name of the person, okay, known person, known recipient, you know who is receiving this letter by name, known receiver, okay, who is receiving this letter, known, okay, you know him by the name, because you are writing his name in the first line itself. Mr. Abraham Lincoln, Dr. Steve Parker, like that. You know the name of the person. You know the name of the person. This is the condition. So 6.1. Then how it will be? Then it will be yours sincerely. You will write yours sincere. If you know the name of the person, you will write yours sincerely. Okay. For example, in the first line it is written, this 1.1 is equal to 3.1 is equal to 6.1. 136. They are matching. 1 is equal to 1.1 is equal to 3.1 is equal to 6.1. So they are together. They are matching. Now, how they are matching? In the first line, 1.1 line, Dr. Abraham Lincoln. Then in 3.1, it is Dear Dr. Lincoln. And in 6.1, it will be yours sincerely. Okay, that's it. Because you know the person. You know the person. His name is Abraham Lincoln, Dr. Abraham Lincoln. You know. So, Dear Mr. Lincoln. First line, Dr. Abraham Lincoln, Dr. Abraham Lincoln. A capital letter, L capital letter. First line, 1.1. 3.1, Dear Dr. Lincoln. Don't say Abraham here, because you are repeating the name. First time only you have to use full name. Second time, don't use full name again. Never, never, never. In any letter, when you write a second time, don't use the full name. Remember that. I think I need it. I deserve a tea or coffee. Yeah, let me finish this. Okay, so Dr. Abraham Lincoln, dear Dr. Lincoln, yours sincerely. Now, 1.1, you don't know the name of the person. Then, General Surgeon, Consultant on duty, Registrar, Head of the Department, Dean, Director. Such words are there, and these are not the names of personal names. They are professional names. They are called as a designations. When such things are there, the 1.1 will be like that. 1.1 will be like that. Endocrinologist, senior consultant, consultant on duty, head of the department. Like that. Then you cannot write the name. So you will say, dear doctor, dear registrar, because you don't know the name. You can't do anything. You can't give an imaginary name because name is not given. So you cannot imagine which is not given. So don't do that imagination because it will be a mistake. So you will write, if it is there, consultant on duty, you write a dear doctor. That's it, because he's a doctor. Consultant is a doctor, no? Consultant is a doctor. So dear doctor, there in the 1.1, it is consultant on duty. Dear doctor, yours faithfully. So 6.2 is Y capital letter, yours faithfully, F small letter, sincerely, S small letter, and comma. In 3.1, you should put a comma. Dear Dr. John, put a comma. And here, yours faithfully or yours sincerely, put a comma. But other places, addresses, no need comma. Any other place, no need. Okay. So 3.1, dear Dr. John, dear Dr. Parker, then put comma. And yours sincerely put comma, yours faithfully put comma, because many people do mistakes there. Many people, some people don't put comma. That also is a problem. Other places, no problem. But these two places, salutation and closing remarks, you must put a comma. And many people put capital F. No, small f. Capital S. No, small s. Yours sincerely, if you know the person by name, yours sincerely. If you do not know the person by name, yours faithfully. No confusion. Very clear it is. Very clear. So, is that clear? Can I see clarity? Can I see a clarity? 1.1, name of the person is there. If it is understood, then say yes. Please. Because if you are confused, then I have to make it clear. No? So, next one is the sender's particulars. Is the sender's particulars. This is 7, component number 7. Sender's particulars. Yeah, Regina, you can attend the full session. And if you are interested to join our classes regularly, yeah, we have one more place, two more places. One place she asked me, but she did not join. So 2 more places are there. Yeah. One place Jacqueline took. After that, another lady from Ghana, she asked me, but she did not join. So 2 more places are there. If you are interested, you can join, but you will get admission only if you stay till the end of this session. You should prove to me that you are very serious, you are dedicated, you are hardworking. Class is priority. This is very, very important for me. You have to prove by staying till the end of the class. Before me, if you go out of the class, you will not get the admission under any circumstance. No, even if you give any amount of fees, I will not give you admission. So if you want admission, you can stay till the end of the session. That's the challenge for you, right? Because I normally don't give admissions for many students. I reject. Yeah. So senders particulars. Now 7.1. 7.1 will be the name. Here also the name of the sender. If it is given, you write. Sometimes they'll say, you are Miss Margaret Thatcher. They will say, you are the nurse, ward nurse, Mrs. Jeremy Parkers, or something else. If they give the name, you have to write your name. That is 7.1. Next, 7.2 is the designation. You're a nurse or a ward nurse or a community nurse or a emergency ward nurse or a outpatient department nurse, or what type of nurse, surgical nurse, what type of nurse you are, child nurse, what type of nurse you are, intensive care unit nurse. So what type of nurse you are, that you have to write there. Okay. Nothing is given. Registered nurse, charge nurse, ward nurse, whatever it is, you write there. Okay. If you are a ward nurse, you can say registered nurse, emergency ward or inpatient ward, like that. Finish. That's enough. So 7.3 is the ward or a department. What is your ward or department? Sometimes they will be given, sometimes they will not be given. If they are given, right. If they are not given, don't write. Many people, they write, you're sincerely doctor. Finished. You're faithfully doctor. They won't bother. Many letters I have seen, they don't write this one. You don't know, there are some marks for this one. If you don't write, your marks are not cut, but you will not get these marks which are given for them. For them also, there are marks. Instead of you're not writing, that means your counting starts from 370, 470 only. For example, 30 marks are there for this one. So you are not attempting this last sender's particular. That means you did not attempt for 500 marks. You attempted for only 470 marks. Nah? So your marks limited only till 470. You can never get 480. If you add these things, maybe another 30 marks will come. You are failing there, 340. You have written another 30 marks would come for you. You would have passed, no? You would have passed. But many people don't know that these have marks. They think that if we don't write also, it's okay. Otherwise, why did they give all these details? So the ward or department, if they give your name, write your name. If they tell otherwise, leave it. If they tell you about that you are a nurse, write nurse. If you are a doctor, write doctor. If you are a pharmacist, write pharmacist. If you are a physiotherapist, write physiotherapist. That you must write. Okay? That you must write. Name is given, write your name. Otherwise, you write your profession. Profession you must write, na? Because this is a profession-based letter. You have to write whether you are nurse or whatever it is. You cannot just leave that blank. Then next, which ward or department? Emergency department or outpatient department, inpatient ward, whatever intensive care unit, whatever department or unit, you have to write there. Okay. Then after that, within that one, there will be department also. Ward and department both are there. Inpatient ward in emergency department. Inpatient ward in intensive care department. It may be there. So you have to write that also if necessary. Then next one. Next one is the hospital or the facility. 7.4. The hospital or the clinic or the facility, whichever you are in. Maybe care home or wherever, whatever it is, care home nurse, whatever you are there. Okay. That you will write. Then 7.5, as in the beginning also, same like that one. Whatever given, you write. The street. Then 7.6, already I told you, so I need not explain further here. The village or town or the city. I'm telling all the basic things now. I'm not going into the depth of the letter. I'm not teaching any profession. I'm teaching general letter, OET letter for everyone. That's it. Then 7.7, the state. 7.8, the country. Whatever is given, you write. I'm just giving you all the things. Sometimes they'll give pin code, sometimes they'll not give pin code. Sometimes they don't give the country, sometimes they don't give the states. Anything they wish, that is their wish. Sometimes they don't give anything else. Just you are a nurse, they will say. Just write nurse, finished. And depending on the situation, you can write. If you are an emergency ward, write emergency ward. Okay. 7.9, the pin code. Postal code, we say. Postal index number code. That's it. Finished. The deserts. This is the deserts. So tomorrow I will arrange a referral letter in general for everyone. What is a referral letter? I'll tell. And like that one, daily I'll teach one letter. Okay. Right. Next, finished. Now we are going to B, the main course. A is finished, C is finished. A, starters before lunch finished. C, after lunch finished. So that is soup before main course. This is ice cream or salad, fruit salad after lunch. So that is before, this is after. Okay. So before and after we finished. Now the main course. Where should we write all this? I don't understand your question. In the letter, OET letter. So you came in the middle. That's why you're in confusion. We are doing letters. Okay. The main course. The main course is point number 5. The body of the letter. The body of the letter. Yeah. Are you all ready for the continuation? I think we can start at 10 o'clock every day, the main lecture like this. I think that is better. Every day we'll take at 10 o'clock. Is it okay for you all? So that we can finish before lunch. We are starting a little late. That's the problem. Starting at 11 o'clock. Every day 10 o'clock. Yeah, we have to leave a line before everything. 10 o'clock Indian time. 10 o'clock Indian time. Now, what is the time? I will tell you. Based on that one, you can decide. Now it is 1:48. Now it is 1:48. 1:48 p.m. 1:48 p.m. Now it is 1:48 p.m. That means, according to this time, we will start 10 o'clock. Means 11, 12, 1. 3 hours 48 minutes before. What is your time check? 3.48 hours before. Yeah. Is that okay? I'm start earlier. That's what I'm saying. 10 o'clock. Instead of 11 o'clock, we'll start 10 o'clock only. What do you say? Is that okay for you? Your timing. Your timing. Your timing. Yeah. You check how it is. Evening also classes are there. Whichever are there. Evening 8 p.m. 8 p.m. means after 6 hours from now. Now it is 2 o'clock. So 6 hours from now. Yeah, right. So, 8:20 means early morning you can get up. Now it is 8:20. Oh, that means it is 3 o'clock then. Now 8:20 a.m. I don't know. You tell me what good for you. Right. So now 8:20 a.m. means 3 hours before, means early morning it will be there. Yeah, you can get up early morning then. Otherwise, you can wait for the evening sessions. Okay. So shall we continue? Shall we continue with the main course? Yeah. Are you okay? If you are okay, say yes. All of you. Otherwise, we have to postpone to some other day. I'm okay. I'm fine. I'm fine. I'm fine. I'm okay. Shall we continue? Yeah. Yes, 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 yes. Okay, fine. So we are continuing. Now, what I will do is give me 2 minutes or 3 minutes. I'll prepare some coffee because I have been shouting, shouting, shouting. Na. So I'll prepare some coffee. So give me 3 minutes break. 3 minutes. In the meantime, if you want also to grab some coffee or tea, you can have it. 3 minutes break. Or you can say coffee break, not break. It is just a coffee break. Preparation. That's all. Yeah.
Right. Oh, not even one left. Everyone is there. Wow, wonderful. Marvelous. Marvelous. Yeah, Regina. Regina is there. I thought you will leave. You're there. So you are in the challenge. Yeah. You have to prove that you are very obedient, you are hardworking, you are dedicated, you are going to stay till the end of the session. Then your chances for taking admission are live. Afterwards, don't blame me, huh? Because you see, even Dr. Farhan, okay? So even doctors, they will stay full time. They will not go in middle. That is the level of dedication. You have to be like that because I go into deep subject. I don't need to teach too many things. Krishna in its true meaning. What is this? Okay, right. So shall we start? All are ready? Shall we start? Or shall I give you time? If you are ready, let me know that you are ready. So Safuratu, yes. Others maybe they are going for bringing tea or something. Yeah. Regina is there. Syed Farhan is there. Yes. I got my tea. I did not have my tea. I prepared. That's all. And I brought here. I'm with you. Nishanti is there. Yes. Nishanti, call that Nilani also. No, if she is available, let her come and attend. Na? Call Nilani also. If she is available, at least she'll open the WhatsApp, sorry, video and she'll watch. Na? Put silently and watch. Na? Yeah, Nishanti, will you tell? Yeah, pass on the information. Okay, fine, no problem. Yeah, you can just send a message. Right. So now the main body of the letter, that is 55.0. The 5 is the body of the letter, the body of the letter. Yeah. Now this 5 body of the letter, you can divide into 5 different parts. How many parts? 5 different parts. 5 different parts. Yeah. 5.1 is the introduction. 5.1 is the introduction. Bear with me. If you don't have time, you can leave. Don't restrict me or condition me. Anybody, I'm telling you. Anybody. I am also with you. I also did not have anything. Morning, I had some little light snacks. Okay. So no problem. I don't bother food or anything. When I think about my students, I don't bother about anybody. I don't know when I will stop. I don't know. Don't restrict me because it is going in a flow and everything is going perfectly. Okay. If you don't have time, no problem. You can have this session some other time. Okay. Because you don't have time, don't condition me, sir. This much is you're taking too much time. Don't tell all these things to me. I don't want because I want your results. That's it. Okay. Anybody. Okay. Please don't blame me. I am teaching out of my love and passion, not because you are asking me or you must sit. No. If you cannot attend, some other time we can attend these sessions. This is not important. All this much is not important for you. You feel you can leave. So 5.1 is the introduction. Now, introduction, you can write in 1 sentence or 2 sentences or 3 sentences. Okay. So introduction. 5 point. I'm telling. I'm just an introduction. This is introduction. No, I will not do like. I'll teach you point wise. Every point is an important point here. So 5.1.1. 5.1 is the introduction, and 5.1.1 is the name of the patient. So 5.1.1 is the name of the patient. It must be there under any circumstances.
It must be there in the introduction. The name of the patient must be there in the introduction. Already you introduced the name in the subject line or regarding line, but still it should be there. You can write a full name, no problem. If you don't write full name also, no problem. Mr. Parker, you can write, or Mr. Steve Parker, you can write. Your wish, no problem. Because full name is already mentioned one time before, so no need to mention full name again. But if you want to mention in the first paragraph, you can mention, but not in every paragraph. That is your choice. Even in first paragraph, if you want to mention, you mention. Otherwise, no problem. We already mentioned the name, full name, first in the beginning itself. Regarding Mr. Steve Parker, aged 74. Finished. So now, once you take the full name, next time you don't need the full name. So that's the point. You want to write, you write in the beginning, first paragraph. Otherwise, also no problem. You need not write. But second paragraph, third paragraph, fourth paragraph, fifth paragraph, don't take the full name. Better avoid the name itself. You can use pronoun or you can use passive voice. Okay, I'll teach you how to do afterwards. So the name of the patient. What is the name of the patient? Here the name of our patient, it can be like Mr. John Durant. This is one. Or Mrs. What time we will start? Already started. These people I don't understand. Yeah. So Mr. John Durant. Adults I'm telling first. Yeah. Sir John Durant. Mr. John Durant or Mrs. Grace Wells. So this is, you must write these things. You must write these things. Or Miss Lydia Lincoln or Miss what names are these? Names are problem. Miss Jennifer Waugh. So cricketer Steve Waugh is there, no, like that. Miss Jennifer Waugh. Okay, so these are adults. Okay, Mr., Mrs., Miss, and Miss. Okay, first one is for male, only one, no complication. For females, we have 3 points. Married woman, Mrs. Unmarried woman, Miss. All other relationships and confused relationships, and we don't know any relationship, then it is MS. This is how you are going to write. This is how you are going to write. Then if it is male person and below 18, okay, below 18 years of age, then you will write the full name or first name. First name you have to write, not second name. For above 18, second name. Below 18, first name. Remember that. Not by family name. Personal name will take. Yeah. So below 18, then you will write the full name in the first paragraph. Next paragraph, half name. That's it. First name. So John Durant. Okay. Sorry, John Durant. Finished. Full name. If you want to write only the first name, you have to write. Okay. If you want to write full name, you can. I'm talking about the introduction, not talking the remaining paragraphs. If you want to write full name. Otherwise, write only first name. First names we'll see afterwards. Okay, I'll explain afterwards. First, full name, how to write, I'm showing you. So, Mr. John Durant, full name, or Mrs. Grace Wells, or Miss Lydia Lincoln, or Miss Jennifer Waugh, or John Durant, or girl's name, Barbie Green. Okay, Barbie Green. Green is family name. Barbie is the name of the girl. Barbie Green. So, full name, if you want to write, you will write like this. Otherwise, you will write only half names. No need full name. Then you have to write like this. Mr. Durant, comma. Okay. No need first name. Second name only you will write for adults. Adults only second name, not by first name. It is disrespect for them. Okay, Mr. Durant or Miss Lincoln. Okay, Mrs. Wells. Mrs. Wells or Miss Lincoln. That is, you can call like that full name or like the second name for adults. Or Miss Waugh. Yes. You cannot call them Mrs. because she is not married, but she has somebody, boyfriend or something like that, or live in relationship or any such. You cannot call Mrs. And you cannot call Miss also. Miss is only for unmarried women above 18. So remember that. Okay. Now it is for children. Children means below 18 years of age. What is the name for the male boy? We said John Durant. So we'll just say John. Just say John, not Durant. Family name you will not use. Children, that's love, not respect. For adults, respect. For children, love. So first name we'll take John, that's all. And for ladies, girls below 18, Barbie, that's it. Barbie Green will be called as Barbie. Not family name, not respect here. It's love. Okay, that's it. So this is the way how you are going to, this is the way how you are going to write. This is the way how you are going to write. Remember that. This is the way how you are going to write. So this is in the introduction. Number 1. So 5.1.1 is writing the name of the patient. Okay, next one. 5.1.2. 5.5 is body. 1 is introduction. Point 2 is the concern that which we are presenting. 5.1.2. Okay. Mr. Wilson, who was diagnosed with. Who was diagnosed with. So, what is the stage? The next one is the stage. What are the different stages? You should know. What are the stages? In which stage you are writing this letter? The stages of writing this letter. If you are not going to attend the lecture, that is your problem, not my problem. I am going very deep. I did not go this much deep in any lecture. Okay. So, 5.1.2 is the stage. What are the different stages? What are the different stages? Is it visiting stage? Visiting a hospital. Who visited our clinic? So, is it a visiting stage? Number one, or admission stage, admitted to the hospital. Mr. Wilson, who was admitted to the hospital on the grounds of what? That is different thing. Is it visiting stage or admission stage? Number two, visiting stage or admission stage? Number two, or underwent a surgery. So, procedure. Is it a procedure stage, post-procedure stage? He visited the hospital, then he was admitted, then he underwent surgery. So, stages of development of the patient's medical condition. He visited the hospital. When he visited the hospital, then you said, no, this is join the hospital, admission stage. Now, visiting stage is over, now admission stage. You are admitted to the hospital, not just visiting and going back home. Visited and admitted to the hospital. After admitting, something is serious, so you underwent a surgery. So a procedure, open heart surgery or some other surgery, operation, replacement. What is the procedure happened? So visiting stage, admission stage, procedure stage. Okay, many people just they write the letter and throw it on my face. I don't understand why they are writing. Okay, so visiting stage, admission stage, procedure, 3-1. Any of the stage. Who visited the hospital today? So you can write like that one. Mr. Wilson, who visited the hospital? Okay. Then next one. Who was admitted to our hospital? Or who underwent a so-and-so procedure? Mr. Wilson, who underwent left total hip replacement. So you have to write like, who was admitted to the hospital due to pneumonia? Who visited the hospital because of some reasons? So like that you have to write what stage it is. You have to mention what particular stage the patient is. Okay. Or who was brought in by ambulance. That means you're saying that is an emergency case. Who was brought in by ambulance. He was brought on an emergency situation. So what is the stage is? Emergency stage. Okay. What is his condition? What is his stage? So visiting stage, admission stage, procedure stage. These are three. And apart from this one, there are other stages also. That is called signs and symptoms stage. Signs and symptoms stage. Now, whose signs and symptoms are suggestive of pneumonia? Mr. Wilson, Mr. William Parker, whose signs and symptoms are suggestive of? So he visited and you already observed the signs and symptoms. Then you will write like, whose signs and symptoms are suggestive of? Or whose preliminary investigation? You can say preliminary investigation, just a signs and symptoms. No, you investigated also. Not just signs and symptoms, you investigated. Why these signs and symptoms? Preliminary, but not finalized. Preliminary diagnosis or investigation. That is the stage. You have to take some stage. You have to mention some stage. You should know what you have to write. Signs and symptoms stage. Then based on the signs and symptoms, we'll send some preliminary investigation. Laboratory. Some test we'll send. That's preliminary investigation. Then results will come. Are you able to diagnose the problem? If you are not able to diagnose the problem, then this is preliminary diagnosis only. Then you are not able to confirm the diagnosis. So for that one, you are sending him to confirm. Whose this preliminary diagnosis suggests problems related to heart is being referred for A definitive diagnosis. Now, preliminary, I am sending you to definitive. You should do that. I am not able to. You have to do that one. So this is only preliminary stage. It is not finally confirmed. So help me, please, doctor. Do something for this case. So what is his situation and what you are expecting that from him? So you should know all these things. Preliminary diagnosis. Preliminary diagnosis. The next step. Yeah. So preliminary stage. Next one is diagnosis stage. Mr. William Parker, comma, who was diagnosed with pneumonia, arthritis. Is this, how are you, sir? Anybody passed the exam or what? I want to get information about OET lectures. Sorry, I'm busy now. Okay. Let them join the session. Right. So, diagnosis stage. Who was diagnosed with? Who was diagnosed with? That means definite diagnosis. Who underwent. Then next one is recuperation stage. That means recovering from pneumonia, recovering after left total hip replacement, recovering stage. Mr. William Mason, who has been recuperating after left total hip replacement. So what is the stage that he is in? You have to write. You have to write. What is that stage? Yeah, Dr. Ala, if you have messaged me, I would have sent the link immediately. So otherwise also I'm sending in the groups. No problem. You can take it from the Telegram channel or you can take from the groups also, anywhere. Okay, right. So now here, what is the stage? Visiting stage, admission stage, signs and symptom stage, definitive diagnosis stage, preliminary diagnosis stage, operation or surgery or procedure stage, or recovering from procedure stage. What type of stage is he in currently? That is important. Current stage you have to tell. If you don't tell current stage, what you want to him, how he will know what to do next? What to do next? How will you know? The next one, recuperation stage. So these are the stages. Next one, 5.1.3 is the medical condition. You have to write about the medical condition. One lecture is enough. I don't want to give 100 lectures, okay? Every test, I give one lecture. No need. One lecture, if you attend this one, every lecture is enough for you. This is enough. So, what is the medical condition? So, visiting for pneumonia or admitted for the treatment of pneumonia. Signs and symptoms suggest pneumonia. Or preliminary diagnosis is pneumonia. Or final diagnosis is pneumonia. Confirmed pneumonia. Or who underwent left total hip replacement. Or who has been recovering from left after, who is recovering after left total hip replacement. Try to understand this. So medical condition. What is the condition? What is the medical condition? Is it pneumonia? Or is it arthritis? Or is it COPD? Or is it angina? Or is it renal failure? What is the medical condition? What is the medical condition? You have to write that medical condition. That you can say diagnosis. This one will be there. So is it only diagnosis condition? Or admitted for that one after diagnosis? Or underwent some problem related to the diagnosis? Or recovering after treatment? What exactly it is? But you have to mention that condition. He was admitted for what? He visited for what? Signs and symptoms show what? Diagnosis confirms what? Preliminary diagnosis reveals what? Suggests what? Or recovering from what? Or after what? Or procedure? For what purpose? What is the procedure? So you have to understand that medical condition, what he is in. Okay. Stabilizing insulin levels. Uncontrolled diabetes mellitus. So he was admitted for the stabilization of insulin levels. So why he was admitted? What is the condition? Uncontrolled diabetes mellitus. So you have to give that medical condition, particularly medical condition. If you don't give, it's a problem. Then 5.1.4. So first one is who is that? Second one is what is the stage? Third is what is the condition, medical condition. And 5.1.4. Mr. Abraham Lincoln, who was diagnosed with left total hip arthritis, sorry, diagnosed with arthritis, is being referred. So next is what type of letter? 5.1.4 is the type of letter. What type of letter is this? What type of letter is this? 5.1.4. What type of letter it is you are writing? Is it a transfer letter? Is it a discharge letter? Is it a referral letter? Okay. Mr. Abraham Lincoln, who was diagnosed with arthritis, is being referred for surgery, for total hip replacement. Referral letter. Same problem, discharge letter. Mr. Abraham Lincoln, who underwent left total hip replacement, is being discharged back home. Discharge letter. Mr. Abraham Lincoln, who has been recuperating from left total hip replacement, He's recovering. He did not recover fully. Recover fully, direct discharge. Try to understand that one. Still recovering, not completely recovered. Mr. Abraham Lincoln, who has been recuperating after left total hip replacement, is being transferred to your facility for further management and regular monitoring. Until he attains absolute recovery. And then he can be discharged back home. Discharged back home to the final abode from where he came. So referral, discharge. So what type of letter you are writing here? What type of letter you are writing here? I was afraid Syed Farhan left the class or what? Okay. Farhan, don't leave. I have a gun with you. Maybe I'll shoot you. Okay. My gun is a camera, not revolver. Okay. I have a gun to shoot you. I'm checking whether you are there or not. You have to stay there. You have no excuse. Because of you only I'm taking. Okay. Right? You know the pain. Huh? It doesn't mean not for others, for everyone. But he is the initiator of this class. Sir, give me basic information, sir. He requested. Okay. So as you people request, then I'll call. That's all. So whenever I give sessions like that, attend. When I'm online like this, you don't miss the session because it will be adding to your glory every time. And I was checking whether Regina is there or not, so that one admission I can cancel. No, I'm very happy when I cancel somebody's admission. Make me okay, right? When I am happy when I cancel somebody's admission, really I'll be very happy. That means that they don't deserve my class. That's all. Yeah. Why I should give such people admission? I don't give. They have to prove that they are worthy of these classes and they deserve these classes. Then only I'll give. Right? That makes me happy. If they are till the end of the session, I'm very happy. Yeah, this student deserves my class. I'm very happy and I'm very proud that they are very serious and dedicated. Yes. Yeah, Syed Farhana. Yeah, you are here. I know. No, I was little scared whether you are there or not. Okay. If you are hungry, go you take bring your food and eat, no problem. But you be there. Yes. So next one, because I also did not eat. I am not eating. I cancel my lunch. I'll eat afterwards. No problem for me. Once I am in the class, I don't bother about anything. I have some tea and some water. That's enough. Tea and water. That's it. I'll just have a sip of it to wet my tongue. That's all. Yeah. Because it becomes dry, no? Next. So the 5.1.4, there are three types of letters you give mainly. So is it a referral letter? So 5.1.4.1 is the referral letter. I want to join your class. Okay, let me give the message. So, okay. So, referral letter. Referral letter. Referral letter. So, what is the referral letter? I told you already. The lecture is finished. That lecture is finished already. This is another lecture, second lecture continuing now. Advanced level, in depth we are going now. So, referral letter is a letter, okay, you are writing to a higher authority because you cannot handle the situation. You are referring to a senior or specialist person. That is a referral letter. Or normal hospital to a superior hospital, to a private, from a private doctor to a super specialty hospital, whatever it is, like that. So you are writing such a letter. Number 2, 5.1.4.2 is the transfer letter. Transfer letter. The transfer letter, referral letter, you will write the intensity is more and you cannot handle.
The condition is more powerful than you are. Then you will write a referral letter. You are powerful and the condition became normal now. The condition is not serious now. The condition is less powerful than you. So you treated him. So now you will transfer the patient to another locality to continue the services. Transfer from a higher level to the lower level, from ICU to normal ward, from emergency to general ward, from a higher hospital to a lower hospital. Then next one, is the discharge letter 5.1.4.3. This is the discharge letter. Discharge letter means you are not sending him to the higher authority. You are not sending him to the lower authority, but you are sending him to the patient's final abode or the patient's initial abode. He is going straight from the original place from where he came. That is discharge. Okay. He is going to his final destination, not intermediate destination. Referral to intermediate destination, transfer to intermediate, but discharge is to the final destination. If he lives in the care home, a resident care or aged care residence, then he is going there, then it is a discharge letter. Discharge back to your residence, because that is the ultimate. He lives there only, so he is going there only. Otherwise, he is discharged back home. So where is he discharged? You have to see that particular thing. So remember, referral letter is upbound, transfer letter is a downbound, and discharge letter is U-turn, direct back home. Okay, that's the point. So referral letter is junior to senior, general practitioner to specialist, or lower hospitals to the higher hospitals. Okay, so that is referral letter. Transfer letter is from higher, reverse of referral is transfer. The next one is discharge. That means he is going to his final destination. If he is going to his family, he is going to his family. If he is going to his house, he is going to his, from where he came originally, where he started, or finally where he is going. That is discharge. Okay. He is going to the same place from where he started the journey. He started from home, he is going home. Then it is called discharge. If he is going to the resident care home, and it is from there he started, then that is discharge. Remember that.
So then you have to use the word back. Discharged back home. That is called destination. That is called destination, final destination. So that is where he is going. 5.1.5. This is the destination. The destination. If he is referring, where you are referring? If he is transferring, where you are transferring to? And if you are discharging, where you are discharging to? That is called destination, final destination after leaving this place. So this is departure from here, destination where? If he is departing, if he is leaving this hospital, where is he going to? The next destination, not final destination, the next destination. So the next destination after this letter. Okay, who is going to take this letter? So if it is a referral letter, he is being referred to your facility. to your facility. Okay. Then, if it is a transfer letter, to your facility. Okay. Then, discharge letter, to your facility or hospital or clinic or whatever it is, or you can say discharged back home or back to your facilities. This word back will be there here. Back to your facility. You remember this one very carefully. Discharged back to your facility. Yeah. So this is the next point which I have told you. So what is the name of the patient? What is his stage? What is his medical condition? And what type of letter you are writing? So 4 points we have done. And the fifth one is the destination. We have seen now. What is the destination? So 5 things we have discussed now. How many points are there in the introduction? Listen to me. Name of the patient. What is the stage? What is the medical condition? What type of letter? And what is his destination? Okay. Referring to your specialty hospital, referring to your facility. Okay, like that. Now, next one, number 6. Number 6. 5.1.6. This is called the purpose. Very, very important. You have 1 mark for this. The purpose. You have 1 mark for this. 3 marks will be there for the introduction. 3 marks. The purpose. 3 marks. Okay. For purpose, you have 3 marks. In that one, there are again 3 points. So, where is the purpose in the introduction? So, the purpose. Are you communicating the purpose? Why you are sending this patient there? Why are you sending back home? Why are you sending? Why are you discharging him? Why are you referring him? Why are you discharging? Why are you transferring? What does he require after your referral? What does he require after your transfer? What does he require after your discharge? That is called purpose. What does he require? The requirement. This requirement, we can call it as a mandate. This is the reason. This is the reason why you are writing the letter. If this reason is not there, you will not write the letter only. That is very, very, very crucial. Now only we came to the purpose now. This is very, extremely important. You are writing this letter because of this purpose only. This purpose decides what type of letter it is. This purpose decides where he is going. This purpose decides what he wants. This purpose decides what you want them to do. This purpose is the goal. Okay. Everything is depending on this purpose. The entire letter is because of this purpose. The patient is because of this purpose. The doctor who is writing this letter is because of this purpose. The person who is receiving this letter is also because of this purpose. Whatever treatment is, everything because of this purpose. So purpose, don't play the fool with the purpose. Don't play the fool with the purpose. So he requires, so Mr. Wilson requires what? What does he require? So 5.1.6.1. So what does he require? So you are referring him because you cannot handle the situation. You don't know. You are only seeing his signs and symptoms and preliminary diagnosis. You are sending him for, okay, his preliminary diagnosis. You know, you're not a specialist. So you're sending it to the oncologist, or you're sending him for the cardiologist, or you're sending him to the craniologist. You're sending him to somebody special. When you are doubtful, more than 75%, but this is related to heart. So you'll send to the heart specialist. If you're not sure, you will not send to the specialist. Because which specialist you have to send, you only don't know. If your signs and symptoms suggest it's a heart problem, you'll send to the heart specialist. But even after finding out signs and symptoms, you are not able to decide what exactly is the problem. So you will refer him to a super specialty hospital. You will not send it to the specialist. You will refer to the super specialty hospital where all different types of specialists will be there. Try to understand this particular point. Many people don't know. They are not clear. I think Syed Farhan and Dr. Ala can explain this one. What do you say, Syed Farhan? Do you accept this one? Can you unmute and tell me?
Yes, sir.
What I'm saying is sense or not sense?
Sense only, sir. Sense only.
Absolute sense, right?
Yes, sir. Yes, sir.
If you know that, if you doubt that this is related to heart, you can send it to a heart specialist. You don't know what exactly problem it is there. So to whom you will send? You only don't know. You don't know what is the problem.
Yes,
If
sir.
you doubt this is related to this above 75%, then you can send. Otherwise, why you are risking the patient unnecessarily some more time, wasting some more time?
Yes, sir.
So preliminary diagnosis is means 90% correct. Then only you can refer to that particular. Otherwise, if
Yes,
it
sir.
is less than 75%, don't send to anybody.
Yes, sir. Yes, sir.
Yeah, that's what it is. Then where you have to refer? You have to refer to a hospital.
Yes, sir.
You have to refer to the registrar of a hospital. You have to
Yes,
refer
sir.
to the dean of a hospital. You have to refer to the in charge of the hospital,
Yes,
where
sir.
he will get a preliminary diagnosis, getting all the tests, and based on all the tests, he will make a sitting with the 2 or 3 doctors. So he will have a doubt. Dean is not an ordinary doctor, he is a specialist only. And he is not one specialist, he is multi-specialist. He is specialist in surgery, he is specialist in cardiology, he is specialist in something else. 3 or 4 specialists he will have. MS ortho, MS that, MS this, like that. 3 or 4 specialties he will have. So he will be made a dean. Not everyone will become a dean. So otherwise, he will make a 2 or 3 doctors sit and together and they will have a discussion. Then afterwards, yeah, this is for this department. So that is how it goes. I don't know how it goes, but my mental capacity presumes this way, and no doctor can say no. Because logical sequence, you can move back now. Dr. Farhan, thank you for responding. So here, the reason, purpose. So are you sending him because you are incapable to diagnose, or you are incapable to diagnose? You're not able to decide. So you want to diagnose him to diagnose. Who requires a diagnosis? He requires diagnosis, definitive diagnosis. Definitive diagnosis. Now, he may require a definitive diagnosis because you are not able to diagnose him. So you conducted some tests, and he may require 5.1, 0.6.2. Be very careful. These points are very, very important. 5.1, 0.6.2. It may be definite. I am not able to find the definitive diagnosis. I'm not able to diagnose the problem. Preliminarily, I tried something, but I'm not able to diagnose. I think it may be this one. Or I don't understand anything, then I'm sending him for definitive diagnosis. That is one purpose. I'm not sure. So you make it clear. I'm not sure. I'm helpless. I'm helpless. Please help me. So you're requesting for help from a senior who is even powerful than you because you are helpless. You're taking the help of a senior or a specialist. That is the purpose why you are sending him. If you are able to diagnose, then why you will send him? It is beyond your scope, beyond your control, beyond your capability. So that's why you're taking the help. It's a referral letter. And you're asking somebody to help you. That's for definitive diagnosis. I'm not able to diagnose what exactly it is. I'm not capable. So please, you doctors, all doctors, super specialty hospital, you do something for this patient. He needs something I cannot do. That is definitive diagnosis. Next one. One doctor, he says he does a lot of tests. He examined the patient, but he cannot digest exactly what the situation is. Signs and symptoms are there, but he cannot analyze what exactly it is. He examined the patient, he tested the patient, but it is beyond his. So, I did some tests, but I cannot conclude. I cannot conclude, I cannot confirm. So, what you do? I did some minor tests. So, he requires further assessment. Or you can say further evaluation. Or further examination. Words are different, but it is the same. 3 words I gave. It doesn't mean they are different. Further assessment or further evaluation or further examination. Do anything you want. You want a definitive diagnosis? That is one purpose. You want them to do further tests because based on what the tests I have done, I am not able to analyze anything. So you do other tests what are required because I don't know what the other tests which are required. I myself don't know. So you please. I'm sending what the tests I have done, and based on that one, I'm sending all the report. So you try to do further examination, further test, further assessment, further evaluation. You do whatever it is required. So that is the purpose. That is why I'm sending. I cannot do this further evaluation. So I stopped here only. This is my limit. It is not unlimited for me. This is my limit. Beyond this, I cannot do anything. So you are powerful. So you are strong. You can do everything. You have all the facilities. You have all the knowledge. You have all the wisdom. You can do it. Please do it. Something. So you are sending a referral letter because you are weak in this area and somebody strong has to take action here. This is a very thin line where the doctor has to take the responsibility because he cannot play the fool with the life of the patient. Many doctors are easygoing. They'll just give some treatment. My mother suffered. She passed away with cancer because of that negligence of a doctor. Not one doctor, many doctors. We have shown to many doctors. They said this is something, this is something, this is something. By the time that was diagnosed, it was 4th level cancer. I feel very sad. Tears drop from my heart, not from my eyes. One doctor, village doctor, he said, after a lot of time, just like that, casually went some. He told what, get me all your reports. Oh, you have seen so many doctors, neurologists, this. Why don't you go to the NIMSA hospital, sir? Nizam's Institute of Medical Sciences in Hyderabad. One of the world's renowned hospitals. They said it is stage 4 cancer. This village doctor, he said, why this all 12 dozen or more doctors did not refer that common doctor? Why? He told me ordinary doctor he was, not even well known. He did not think about money. He did not think about anything. He did not take the fees also, really speaking. He said, I don't want anything. I'm not doing anything to you. I'm just giving a suggestion. If really this doctor had been in the first doctor's place, maybe my mother would have been alive today. 24 years. I remember her. Every time I talk these things. Doctor's role is so gigantic in the life of every patient. And how come some doctors behave stupidly? They are angels in the lives of the patients. And they take things so lightly. I'm a teacher. I cannot play the fool with your life. So that's why I give so many things. Is this? See how many admissions. They call me. I don't bother. Admissions, if they want, they'll come, they'll wait and they'll be after me. I don't mind. I just give them the link to join in the session directly. So I want them to come and test whether they are joining the session and they are serious or not. So here, be very careful. It is your responsibility. You're an angel. Be an angel in the life of a person, or you're a demon in the life of that particular person. You cannot be a normal doctor. You're either an angel or you're a demon in his life. That's all. Do you want to be an angel or do you want to be a demon? This is the thin line where you have to decide. Money, bloody money comes and goes anytime. Just for a few bucks. Many people prolong the cases. They don't bother. If you have attended the patient in time, his life would have saved. That's it. Be careful. You are as your teacher, I'm telling you, it is your responsibility. God has blessed you in that position because he trusts you. That's why he made you a doctor. Otherwise, you would have been a pauper or a beggar or something else. You are a doctor because God has blessed you. He anointed you. He put his hand on your head and he anointed you with oil and said, go save my people. And many useless fellows, they don't bother about the patients. You're blessed by God. Yes. Because God trusts that you do something great. So, evaluation. I cannot evaluate. I don't know. I don't have that power. I'm a normal physician. I'm a general practitioner. I'm a physician. I'm a normal doctor. I cannot. So somebody do it. And you don't block the way. Let him pass the channel to the right direction. That is what you have to understand. If you're an excellent doctor, your letter will be A grade letter. If you're an excellent doctor, your letter will be an A grade letter. That's it. You will be an excellent doctor if you're an excellent person. If you're an excellent human being. Yes. Human qualities. Or human qualities. Okay. First one, you should be an excellent human being to become an excellent doctor. Right? So, you decide whether you can do it or not. If you cannot do it, refer the patient to the person who can do it. If you are an excellent doctor, if you have already done, don't let the patient be there with you because more important patients may come in that place. So you can send this patient to somebody else, some other care or rehabilitation center where they can also get some money. You don't keep the patient here. Keep him for another 4 days. He should be in observation. You know that he's doesn't need that much observation now. Then you can pass on to somebody else who can take care of him. Okay? From ICU. ICU, more money I'll get. So let him be in the ICU. No. Transfer him to the general ward. Somebody else may need ICU. Okay? So that's it. Transfer him to the lower or refer to the higher authority or transfer him to the lower authority. Now that much importance is not needed. So transfer him to subordinate. Send him to the general practitioner and ask him to monitor him. Yes, specialist need is not needed. Others can monitor them. Nurse can monitor them. Emergency cases there, you can refer. Not refer, you can send them back to the patient, doctor again if situations. A review you can conduct. Don't keep him until review there for 15 days or 1 week. Sorry. That doesn't make you a good doctor. There is nothing called good doctor. Every doctor must be good doctor. But only that one is main qualities will be the excellent doctor, not good, better, best. It should be excellent.
Yeah. Right. Next. So further evaluation is second point. First one is definitive diagnosis. Second one is further assessment or evaluation or something like. Third one is who requires ongoing care. So ongoing care. 5.1.6.3. So this is ongoing care and appropriate management. So two things in one. Ongoing care and appropriate management. The care which we are continuing here, you should continue. He need not stay in the hospital. You can take care of him at home, or you can take care of him at the rehabilitation center, or you can keep him in the general ward and take care of him. So he doesn't need that much high level of monitoring and super specialty ward he doesn't need. So we are sending him, you follow it up. Ongoing care, that means continuity of care, ongoing care. Continuity of care, ongoing care, or regular monitoring. Ongoing care means regular monitoring, that is another word. Regular monitoring. So ongoing care means regular monitoring. So now regular monitoring for what? So monitoring what? So he needs ongoing care for what? Appropriate management for what? So that is the next level that I'll tell you afterwards. So what you want them to do? Care, diagnosis, or you want surgery? Who requires a replacement? Okay. What exactly you need them to do? So you want them to assess or evaluate or examine, number one, or you want them ongoing care and appropriate management, or you want them to have a definitive diagnosis. What exactly you want them to do? To follow up action plan, follow up action plan, management. Appropriate management means follow up action plan. Okay, or the next one is 5.1.7. 5.1.7. Now what is this? For what? Is it for medication compliance? What does he require? Medication compliance or a dietary regimen dietary regimen or exercise program, what have you to do? So follow up what? Manage what? Manage his food, manage his diet, manage his exercise, manage his medication. What exactly? Okay. Review his medication or suggest alternative measures. What exactly? You want them for what is you're sending him for managing or for assessment or for definitive diagnosis? If it is definitive diagnosis, so what exactly you want them to do, you have to tell them very clearly. Or if it is a higher authority, don't tell them, they will do it themselves. You only don't know what to do. Then how will you tell him what to do? Be careful. Don't advise a higher authority. Don't recommend a cardiologist to do something. Be very careful. You accept that you are not able to do. That's enough. I am referring him for further evaluation. You do whatever you want. Don't tell him, do this, do this, do this. Don't tell him. Be very careful. This is interdisciplinary decency, we call it. Interdisciplinary decency, you have to respect according to the level of the person. For example, there is a husband and a wife. Husband is a nurse and wife is a doctor in the same ward, in the same room, operation theater. Now the wife cannot tell the doctor anything, or the husband cannot tell the doctor anything. Try to understand this. Relationship doesn't matter here. Doctor is doctor. Okay. Relationships are a part. Doctor is a doctor, nurse is a nurse. Nurse cannot tell anything to the doctor. Doctor says, give me my 4 CPs. Why, doctor? Why do you want 4 CPs? Give me that 4 CPs, which is this number or something. No, doctor, I have brought this only. Do you want me to bring that? Useless fellow, I'm telling you to bring 4 CPs. Go and get it. The patient is in the operation theater and you ask me questions. You're there to assist me, not ask me questions. Absolute obedience. When you are junior, the profession demands. If you are junior doctor, the same thing with the senior doctor, because you cannot advise a senior doctor. You can just tell your opinion. That's all. You cannot tell him do this, do this. Interdisciplinary decency, we call this. I don't know what you call in medical terms. I don't know. Be very careful. You are communicating to somebody else. You're communicating to somebody else. Higher authority. You're accepting that you cannot do it and you are giving the responsibility to other person and you are asking them to do something what you want them to do. Never do that. This is written communication. You are wronged. You cannot do that one. So be very careful. And when you are higher authority also, you cannot impose your dominance on the other person. A doctor cannot say the nurse, go and bring that one. No. Decency. Interdisciplinary decency. You cannot command. Okay. There is some decency in asking somebody to bring somebody. Command, order, and request. You cannot hurt the feelings of the other professional. Nobody is less, nobody is more. As a human being, nobody is less, nobody is more. And every profession has its own dignity. Remember that one when you are messaging here. Okay. Remember these things very much. When you are writing, when you are speaking, maintain the decency. Respect the other professional. Dignity of labor. Even the nurse, you can say. You need not say, please. You need not say. get me that 4 CPs? Can you get me that 4 CPs? Request, no need of please or kindly. Request can be understood. Okay. No need of saying please or kindly. Would you mind getting that 4 CPs? Can you get that 4 CPs? Request. Get that 4 CPs. Okay. Order. Get the 4 CPs. Okay. Command. 4 CPs. Command is shorter than the order. When you say come, stand. This is command. Stand up. Order. Can you stand up? Request. What is the problem? So the way how this is a formal letter, remember, formal letter. When you are telling somebody to do somebody, tell it politely. Formal letter. Tell it politely. That's very, very important. Politely. Somebody is there with the name Xiaomi. I cannot call you with the name Xiaomi. So please give me your first name and second name. Because sometimes I see some people coming with some other names and then they put something, scribble something on the screen and go off. Some virtual material, something, technological problem. One time I got problem with my computer. So that's why. Please give me your name. Okay. I'm giving you 5 minutes. No problem. Give me your name. Okay. I'm happy to teach you people. No problem. This is a request. You're coming and I'm giving you the chance. Please give me your name. First and second. I cannot call you by the name of Xiaomi or Shamsung or iFran, something like that. So now here, politeness to the lower people or the higher people. Politeness, interdisciplinary decency must be maintained because this is a formal letter. It's an official letter because if you write anything wrong, you will be questioned. Be careful. Right. Especially when you are in an English speaking country. They'll mind things very seriously. If you call an English person with the first name, they'll get angry. Are you my close relative or not? You're calling me by my first name. Huh? They'll say. So be careful. So that is the point. So what exactly you are sending him for? For managing what? For managing his diet? Or for removing the sutures? Or for regular daily dressings? Who requires regular daily dressing changes? You're writing to a nurse. He requires regular daily dressing changes and regular monitoring, wound care of the surgical incision site. What is the purpose? The purpose is going to the patient's house every day and removing the old dressings and putting new dressing. So regular daily dressing changes, that is the purpose. So it may be anything according to your profession and according to the condition of the patient and according to the purpose. Anything may be there. So you have to write that very carefully. The next one. So that is 5.7. Then 5.8. 5.1.8. Yeah. So now let us recall all the sentence words now together. Mr. Parker, who has been recuperating after left total hip replacement, is being referred to your facility for ongoing care and appropriate management. That's it. Finished. And any additions? That is the last one. Any additions are there? you can write there if you feel that it is important. If you feel that it is important, you write down there. And only important points should go into the introduction. If you write in 3 sentences, you will get 1 mark. If you write in 2 sentences, you will get 2 points. If you write 1 sentence, you will get 3 points. Reverse. Okay. See, I told in 3 sentences now. Now see, what are the 3 sentences? Mr. Parker, who was diagnosed with, who underwent a left total hip replacement, is being referred to your facility for ongoing care and appropriate management. 3 sentences. Mr. Wilson underwent left total hip replacement. That is 1 sentence. I am referring him for ongoing care and appropriate management. Okay. I am referring him to your facility. That is 2nd sentence. He requires ongoing care and appropriate management. 3rd sentence. 3 sentences, if you write separately, you will get 1 point for that. 3 points. Because quality is very poor and very low. If you write 2 sentences, you get 2 marks. If you write 1 sentence without mistakes, you'll get 1 mark. Okay. Right. How to write this 1 sentence? Mr. Parker, who was diagnosed with diabetes mellitus, or who was admitted to the hospital with unstable diabetes mellitus, is being referred for management of his insulin levels. So like that. So what is the patient and his problem? What is it? What are you doing? You are sending a referral letter or what you are doing? The next one, what he requires. 3 things. Patient and his problem, you and the type of letter. 3, he and what he requires. Patient and his condition. Something went wrong. Okay. Yeah. Something went wrong, I think. Yes. Yeah, Regina, I am pleased with you. I am pleased with you. Something, where is this? Yeah. Yes, I'm sorry.
Network problem, I think. I was focusing and it went off and it came back. Yeah. Not here. Give me a second. Yeah, I'll start from where I left. Yeah. So, Mr. Wilson, who was admitted to the hospital having contacted pneumonia,
is being discharged back home. Okay. First sentence, full stop. He requires, I'm giving two sentences style now. He requires ongoing care and appropriate management of his dietary, medication, and exercise regimens. So two sentences I made. This I will make in one sentence now. Mr. Parker was admitted to the hospital having contracted pneumonia. Earlier I said contracted pneumonia. Requires ongoing care and appropriate management of his medication, dietary, and exercise regimen following the discharge back home today. That's the point there. Following the discharge back home today. Yeah, I was checking for you, Syed Farhan. I was checking for you. Right? We are coming to the introduction. Very, very important. This is very, very important. Afterwards, it's simple. Introduction is very important because, head, if you see, you know what is the body. Body is very big. But if there is no head, no body, nothing, no, you cannot say anything. It is worthless. So head is very important. Okay. Right. Please don't leave. Yeah. So, I told you some additions, no? These are the additions. So when discharged, so discharged back home today, discharged back home tomorrow, discharged back home day after tomorrow. So when discharged, that is an additional. Whatever, there may be some additions. I cannot tell all those things. You see according, you can write. Mr. Wilson, who was admitted to the hospital having contracted pneumonia, requires ongoing care and appropriate management following the discharge back home today. The today is an extra. I told you, additional information. Any information, I just gave you a point there. There may be tomorrow, today, day after tomorrow, when, and there may be many other points which it differs. Additionals may differ from letter to letter. I cannot tell all these things. So introduction is clear. Now it is very easy. We can just jump forward. Okay, just jump forward. Then other things we'll see in each letter because in each letter things vary. I cannot say second paragraph what, third paragraph what, fourth paragraph what, because those will differ according to the referral letter. If it is an urgent referral letter, today's visit will come first. Urgent referral. Okay. Transfer and discharge will not be urgent. Transfer and discharge will not be urgent. Okay. They are referring the patient to a higher hospital only. So, then only urgent. So referral is urgent. Not all referrals are urgent. Urgent referrals mostly. Okay, there may be some exceptional cases that different. So urgent letter. In urgent letter, today's visit is more important because of the urgency of the situation. Emergency of the situation. When the letter is brought to the doctor and given it, he will see the first thing, first introduction. And say, he will not read further. They bring the patient. Take him to the operation theater. That's all. That's all. I don't know. I'm not a doctor. Because I'm teaching a lot of doctors, so I'm getting that ideas, those ideas. So see in the letter, remaining things you can read afterwards. He requires immediate evaluation and appropriate management. He requires immediate assessment. Finished. He stops there. Immediate asset. Come on. That's the seriousness. Okay. So, while the patient is coming, he will read the first paragraph because first paragraph is important. He will not have much time because patients will rush the operation theater or somebody or emergency room. In that limited time, he will have only one paragraph to read. That's all. He will not read everything else. Afterwards, not urgency matters. They are there in second paragraph and third paragraph that he can read leisurely. After the urgency is become normal. He can read afterwards. So, today's visit, what happened today is of priority. So, you should put in the first place. If it is not urgent letter, discharge letter, transfer letter, you will give today's letter. They'll come according to the story building up. First visits, then next visit, then next visit, like that it will come. Normal letters. I hope you understand what I'm telling you. So when I get an urgent letter, I'll teach you about urgent letter because I cannot teach you all those things here. No? Because it depends on the type of letter because that is the purpose. That is the purpose of the letter. Now, purpose modifies the letter. If in the urgent letter, it is said, if it is in the purpose, emergency, A&E department, that means in the first paragraph, there will be today's visit only and nothing else. And next, there will be the other visits. Just giving a brief only, okay? Afterwards, I will say according to the urgent letter. So today's letter first, other visits next, and histories next. Because you are not going to tell in urgent letter to the higher authority, you cannot tell what he has to do. You are not giving any plan to him to do like this, do like this, do like this. You only cannot do and you are sending him to the higher authority and you are asking him to do no. You can tell his condition also, that's all. Today's visit, first paragraph. Syed Farhan, note down these points. Urgent letter. Today's visit, first paragraph. First paragraph is introduction, but this is main body paragraphs, 3 will be there. Introduction, conclusion, main body paragraphs 3 I am talking. When I say paragraph 1, paragraph 2, paragraph 3, main paragraphs. Introduction is eliminated. That is A. This is B. This is Z. A is introduction, Z is conclusion. So I will not bother about them as paragraphs only because they are not. Okay. First one is high, last one is by. So they are not that much. These are important here. In depth. So urgent letter. Today's visit, first paragraph, today's visit. Next paragraph, other visits. Next paragraph, histories. Social history, family history, medical history, and habits history, drinking, smoking, anything else. And is weight, body mass index, and all the other things will go there. So today's visit, other visits, histories. This is the order. Okay. Next, if it is ordinary letter, so this today's visit goes off. So it will come according to the order. Now, next important letter is discharge letter. Discharge letter. Most important letter is urgent letter. Next important letter is discharge letter. In the discharge letter, there will be something called a discharge, called plan of action. So you should create this plan of action. There in the urgent letter, you cannot tell him anything to do. You cannot tell him anything to do. But here, you are the ultimate in discharge letter because you are discharging him. You are the authority to tell him what to do. And you are the authority to tell him what not to do also. Everything what you tell, only that he has to do. And whatever you don't tell, he must not do. Remember, this is the opposite of that one. So that is why this is very important here. Okay, next to urgent letter. Okay. If anything else he does, there will be a problem maybe. So don't do. I told you do this, do that one. I said don't do this, don't do that. That's it. Finished. If you do that thing which is told not to do and there is a problem, that is risk is on your head. So don't do. So do's and don'ts. You will plan A, B, C. What type of food he has to eat, what type of exercise he has to do, what type of diet he has to eat. You have to decide and tell. Otherwise, you have to take the reference of a physiotherapist about his exercises. You have to take the suggestion of a dietitian regarding his diet, and you have to tell about his medication. If you can give everything, you give everything. Otherwise, you take the support of them and you have to give them. But it is you intermediate in between. You should take the recommendations of the dietitian and the physiotherapist and tell him what to do and what not to do. That's it. If you can manage, do it. Otherwise, you cannot manage, take their assistance. This exercise, this 15 minutes of walking every day. You make him walk 30 minutes of the walking every day, he gets into problem, pain. You're telling him, let him walk across 500 meters every day. You'll make him walk 5 kilometers. He will land into trouble. So what he tells, do that one. That's all. Here you are the 100% authority. The other person cannot do anything on his own. He is only to be obedient to your instructions. That is why it is called a discharge plan. You tell him these are the medications you have to give. This in the morning, this in the afternoon, this in the evening. If there is any problem, let me know. Continue this for 10 days or 15 days or 1 week or 1 month. If any problem is there, get back to me immediately, depending on the urgency. Otherwise, after 30 days, an appointment is scheduled. You have to bring him on the 31st day. And I will review. So I have made a review, for an appointment for review, and I noted it and I passed in the discharge notes itself. Review on so and so date. Removal of sutures on after 14 days. A review regarding the medication after a fortnight. Whatever it is there, you plan everything. The other person will not do anything in discharge plan because everything is done 100%. Urgent letter, referral letter, I'm not able to do 100%. It may be 0% or 25% or 50% or 80%, but I'm not able to do anything. I'm not able to decide. So you are 100% deciding authority. That is referral letter and urgent letter. Transfer and discharge letter. I have done everything. You only have to follow it up. 100% recovered, it's a discharge letter. 50% or 75% recovering. You're sending into the emergency zone, then operation is done. He need not stay in the emergency ward still. He can go to the general ward. Once the operation is done, it's normal. You can go to the operation, general ward. Afterwards, he can be discharged home. 70% okay, now he can be discharged home. Why he should stay in the hospital paying fees and other things? Simply keeping one bed for him. That they can do at home also, na? If anything is needed, community nurse or some other nurse will go and check them and come. Weekly once or daily once, they can go and do it. Why should you reserve one bed entirely for one person? There are a lot of negative also there. A person, if there is in the hospital, he feels that he is still a patient. The recovery chances will be lesser. So for that reason, at least you have to send him back home for complete recovery. So think logical. So this discharge plan will be given. So this discharge plan will be the last paragraph. So 1, 2, 3. In discharge letter, the third paragraph will be discharge plan. That means what you are telling the other person who is receiving the letter to do. The receiver of the letter, what he has to do, you are telling everything in the third paragraph. In the first paragraph, you will tell about on admission, what was his condition. In the second paragraph, during hospitalization, how you managed his condition. First paragraph, original condition at the time of admission. Means before admission, how his condition is there, everything you will write there. His condition, his history, his personal lifestyle, everything you will write in the first paragraph. On admission, everything will go there. All the histories, everything will go into the first paragraph only. So before, what came in the third paragraph, in the letter, urgent letter or referral letter, came into the first paragraph here in transfer letter. The histories came there. How was his condition before, at the time of joining? What was his condition? He was breathing heavily. He could not. What happened? Everything you will tell at the time of admission and before. His body weight, his BMI. Everything you will tell in the first paragraph. And in the second paragraph, because discharge letter is related to hospital. Before coming to hospital, how he was? You can say, upon admission will be first paragraph. After introduction and before conclusion, 3 paragraphs will be there. First paragraph will be upon admission. Are you noting down Dr. Syed Farhan? Yes, sir. Thank you very much. You are very obedient. Immediately you will respond. Thank you very much. What does a teacher require more than that? So, why I am telling Dr. Farhan? It doesn't mean that Dr. Farhan is great because he is a doctor. No. It is for the other nurses and other people. Because I cannot command lady doctors. No, they will feel, for example, why this sir is commanding like this? Maybe means I cannot answer. I can, but Dr. Farhan means I can even shout at him, no problem. He's a man. No? I can shout also, he'll take lightly. Okay, no problem. Ladies are gentle. No? Lady doctors are gentle. We cannot shout at them, number one. I can shout at him, hey, sit down, man. I'll say, but I cannot take the same with. Of course, they like me very much, but I cannot. So there is something called respect, limits, conditions, everything. To what extent I go, no? That's why. And second thing is because he's very obedient, all the others will be also following him. That's why. That is indirectly I'm making him a role model for everyone. It doesn't mean that nobody is disobedient. Everybody is nothing like that. Everybody should be disobedient or obedient. Nothing like that. So if doctor sir is telling like this one, that means we also should be. See, doctor is listening to sir how. So everyone will automatically follow that one. That is there are many benefits because of that. Everyone is obedient. That's why they are staying here for so long. Right. So discharge letter. First I told you about urgent letter. Now I'm saying discharge letter. Urgent letter, not normally it will be referral letter only, urgent. So discharge letter. The third paragraph, I mean the main body. Forget about introduction and conclusion. They are A and Z. 1, 2, 3 paragraphs in the center. I'm talking about those paragraphs.
Because introduction we finished. I'm concluding the essay now. Just a briefing of things. So that my personal letters will be, discharge letter will be easy and referral letter will be easy and urgent letter will be easy when I take the letters. At least you'll have an idea about what it is. So, the third paragraph will be the guidelines for the receiver of the letter, what to do and what not to do, and how to do, and where to do, when to do, why to do, how to do, everything. These are called as orders of a superior person to an inferior person here. Person, no, professional. Because the person in authority, the superior, is telling to the subordinate. That's it. There is no inferior person, superior person. The superior to the subordinate. Subordinate. Nothing inferior here. Position, superior position, inferior position. Yeah. Higher level to the lower level. The person who is in the lower level of the ladder duty, then he has to listen to him. He cannot question. Sir, why should I give every day dressing changes? I'll give once in 3 days. Huh? You're only to follow my orders. Who is the doctor? I am the doctor or you? Crazy fellow. You're the doctor? You're telling me? Be careful. Who has the authority to direct whom? Doctor is telling, every day you change the dressing. Is he crazy? You cannot question him. Because he is the master of the situation. He is the commander of the army. Your duty is to follow his. That's it. You are his subordinate. It is his decision. He is empowered or entrusted. He is trusted with the power to pass on these orders. Because he knows the condition, what are his requirements. So, yes, sir. Do this means do that. Don't do that means don't do that. 100% pinpoint application. That's all. 5 minutes walking means 5 minutes walking only, no 10 minutes. Not even 4 minutes. 100% obedience is demanded here. Otherwise, it is the risk for the life of the patient. The condition may deteriorate or worsen. Then that responsibility will be on your shoulders. Okay. One nurse told me, sir, one nurse gave this medication or something, and the doctor did not told him. Just she gave out of her own knowledge, and the person was hospitalized for 6 months. Okay, 6 months. I'm just giving you an example. I'm not giving the patient's name or country name or pay. Just telling, not 6 months, but some time, longer time. Condition was true. I'm little exaggerating. Okay. And they stopped my salary, sir. Other 2 persons were nationals, and I am only the expatriate from other country. Okay. They stopped our salaries, sir, all the 3 of us. Then afterwards, there was an inquiry. And then they found out that expatriate did not do anything, but 3 were there in that department. In the inquiry, she was eliminated, and 1 was found, and her salary was cut out and given to them. That's what that nurse told me. and I got my salary, sir. So that what happens. If it happened in her favor, sorry, if she was found guilty, she would have been in jail. Okay. If she was found guilty, she would have been in jail. So be careful. Okay. You cannot give anything on your own. Nurses or doctors, even doctors. Okay, own assumption. You have to test, you have to do everything, make sure, and then you have to do. If anything happens, then you will be held responsible. Okay. Will be held responsible. Yeah. Coming to this one. So second letter is over. That is discharge plan. So in the first letter, you will write about upon admission, how his condition was, along with his histories and background and other things. And in the second paragraph, you will write about during hospitalization. First paragraph is in discharge letter. First paragraph is upon admission. You'll start this paragraph with upon admission. Second paragraph, you'll start the paragraph with during hospitalization. Third paragraph is post discharge. Start like that one. Post discharge, this is required. The 3 paragraphs. Upon admission, during hospitalization, upon discharge, after discharge. Finished. These are the 3 paragraphs. So histories and everything will go into the first paragraph, because that is hospital is not related to that one. That is in the before coming to the hospital only. So it will go into the first. I think you understood. Did you understand the organization? Say, okay. Okay. Yeah. Now you tell me, did you understand the organization of a discharge letter? So we have completed 2 things. Urgent letter. Urgent letter, you will write about today's visit, others' visits, histories. Today's visit, because today is urgent. Urgent visit, ordinary visits, and histories. All other stories. And in discharge letter, upon admission, how his condition was before and during the admission. Then during hospitalization means from admission to discharge. What happened in between? How you manage the condition. So during hospital. Last one is after discharge, what the other person who is receiving this letter should do. And you will direct everything. Remember that. What you will tell, that only he has to do, nothing else. Okay, sometimes the doctors tell the nurses to write the letter, nurse will write the letter. What doctor tells, okay. So she has the authority because doctor has entrusted her with the authority. She'll write everything. Afterwards, she'll show the doctor and doctor will say, yes, pass it on. That's it. Because she's a registered nurse. But she has to show to the doctor and send. She cannot send like that. So like that one. Okay. Yeah. So that's clear. Next one. Yeah. Welcome, Ban Bakir. I think I was early morning for you. Early morning. Canada, right? Hello, Ban.
Hello, good morning, sir.
Very good morning. What time is it now? 6 o'clock?
6:45.
Oh, 6:45. Early morning to you. Very good. Okay,
Yeah,
fine.
you have a class now?
Yeah, class is going on for the last 3 hours or 4 hours. I don't know what exactly. Okay. It's going on. No problem. You can visit it afterwards. I'll give you the link. No worries. Okay. Yeah.
Okay.
No problem.
Uh,
You can mute back.
I mean, is it our class or this is
Yes,
a
it is.
different?
It is general class, not your personal class. This general class. You can attend. No problem. Yeah.
Okay, thank you.
Yes. Okay. So, right. Now, so discharge letter. The next one is transfer letter. Next one is transfer letter. Transfer letter also almost the same thing here. Okay. Almost the same thing like a discharge letter. Okay. Here also, but it is not final destination. We have done the surgery to follow it up. And afterwards, when he's totally recovered, you can discharge him home. That's what is transfer. Discharge back home afterwards. It is your responsibility to discharge home. I'm not discharging him home. I'm transferring the responsibility to you, or I'm transferring the patient to you directly. So you manage his condition until he fit and fine. And once everything is fine and controlled, then afterwards you can discharge him back home. That's what. So that is a transfer letter. Almost the same like this one. Same like. So this plan of action, you will tell them what they have to do. Okay. Not discharging home, but the discharge plan, you are telling this particular hospital or somebody care home or somebody in between, intermitween. So you are telling them to follow up all these things. That's it. So that's clear. So there ends the session. Oh, one thing, last thing is remaining. So it is conclusion. Body 3 parts I explained, different types of letters. Referral letter, discharge letter, transfer letter, urgent letter, ordinary letter. I gave everything. Now, one last thing is missing. Conclusion. This is 5.5. The conclusion. 5.1 is the introduction. 5.1 is the introduction. 5.5 is the conclusion. 5.2, 5.3, 5.4 are the 3 body parts that we'll see in the other areas. How we have to develop, what should come first, what should come next, what in each paragraph, what should come orderly, that I will tell you afterwards. The conclusion. Conclusion, you have 2 things. Conclusion, you have 2 things. We'll write 2 sentences. You have to reiterate your purpose here. Given the above means as discussed above, or based on the above circumstances, according to the discussion, based on the points discussed earlier, anything you can say, or given the above, this sentence starts like this, given the above, or many other points I'll tell afterwards when I am individual letters. Every letter I'll give one point like that. Many styles. I'll give each letter one style. Given the above, your expertise. There you have written evaluation. Here you have to write assessment. There you have to write assessment. Here you write examination. There you wrote examination. Here you write evaluation. Same sentence here, but in a different style you have to write. Don't write the same thing. There you wrote definitive diagnosis. Okay, here you can say confirm. Confirmation of the problem or something like that. Change and write. I'll give you different things when we go into each particular point. Okay. Given the above, your expertise is required in or regarding or your expertise or further evaluation or further assessment and appropriate management for follow-up action plan would be profoundly beneficial for Mr. Parker. Given the above, further assessment for a definitive diagnosis and appropriate management or devising a follow-up action plan would undeniably benefit Mr. Parker. Or something like that, you write first sentence. Okay, this is called the closing sentence. Closing sentence. Then you will say, in case any additional information is required, I have a lot of information which I feel very important. If you require any additional information, do not hesitate to contact me. So, given the above, your expert guidance and managing the condition of Mr. Parker would be would be profoundly beneficial for Mr. Parker, or would undeniably benefit or enhance the condition of Mr. Parker. So, however you want to write, you can write that first sentence. And second sentence will be, if or in case you require any additional information, please do not hesitate to contact me, or please contact me. This is the closing sentence. This is the conclusion. These 2 points should be there in the closing sentence. So purpose repeated. No, purpose put in a different way. Purpose transformed and presented again. That means, see, for example, when you go to your friend's house to invite them for a birthday party, then you say, hello, good morning. And you say, I came to invite you for my daughter's birthday. It is on February the 2nd. Then you say, how are you? What is this? What is this? My brother is this. My daughter is this. She's studying well, that, this, that, nonsense. You'll talk, everything finished. Then after, don't forget to come to my daughter's birthday. Okay, you are very important. Please do not forget. You'll say. That means why you came, you are telling in the beginning, and while you are going also, you are repeating the same thing. Tell not to forget. So that reiterating the purpose is very, very important. Reiterating the purpose is very, very. Can you repeat, sir? I don't know what you want me to repeat. Yeah, Farhan. Syed Farhan, I told many things. What you want me to repeat?
Sir, that conclusion, this thing, given the above, you
Given
are
the above. Okay, that I will send you the link. You can make a note there afterwards. Okay.
okay.
But I'll
Okay, sir.
repeat. When you asked, I will definitely repeat. No problem. Okay, I'll repeat now. So,
Okay.
if anything also is there, you have to go and revisit the lecture definitely, because there are many points. Maybe you have to make notes, everything, right? You could
Yes,
not
sir.
make
Yes, sir.
everything. So you have to
Yes, sir.
revisit the place. No problem. I'll give you the
Yes.
link. Okay.
Yes, sir.
So, here, yeah, conclusion is very important. You go for a
Yes, sir.
birthday marriage, you are asking somebody to come to your daughter's marriage or something, or what is that called as anniversary or something. You're inviting somebody to come. Then you'll go first, you'll say, hello, good morning, how are you, that and this. Then you'll say, why you came here? I came to invite you for, we are going to have our 60th anniversary or silver jubilee or golden, I don't know, whatever you say. So, silver jubilee means 25. Golden jubilee means silver, golden means 50. Diamond means 100, something like that. So, 75, I think. Okay. So, we are inviting. I came here to invite you. We are celebrating our anniversary, 25th anniversary, marriage anniversary. So, I came to invite you for my anniversary. This is my invitation. Please come. This is the card or pass for that one. Please attend. You'll say. Then afterwards, you'll talk everything. How we are doing, how is your life? Yeah. How is your life? What you are doing? Then how is your family? How is my family? Everything is going. All these things you'll discuss. Then afterwards, when you are leaving, again you will remind them. Do not forget to attend my anniversary. I'll see you there. If you have any requirements or any doubts, you can call me and ask me. That is how you close the meeting. So here also, conclusion means same thing. You should repeat why you are writing this letter, telling that this is important. That means when you are repeating, that means it becomes double important. So that you will not forget that one. Okay. So now given the above, further evaluation or assessment and devising a plan of action or providing the treatment or managing the condition, anything. I'll give a lot of things afterwards. I told you, no? I gave you the basis, that's all. You repeat together. Can you repeat, sir? Yeah, I'm repeating. Okay, so given the above, your expertise, comma, further assessment and devising a plan of action would be profoundly beneficial for Mr. Lincoln. This is one way. Other way. Based on the above circumstances, came again. Just for 1 minute, why it will go and why it come, I don't know. Crazy. Yes. Yeah. Are you able to hear? Where were we? Yeah. Based on the above circumstances, a definitive diagnosis, comma, managing the condition and devising future plan of action would be profoundly beneficial for Mr. Lincoln. Okay. Yeah, that is the conclusion. 2 sentences. The next sentence is, in case, comma, any additional information, in case, comma, write down. In case, comma, any additional information is deemed extremely relevant or prominent. I'm giving very excellent sentences. Many people will write, if you require anything, contact me. Anybody will write, but quality, that also, that will not be counted in word count, but quality is, marks will be there. Okay, word count only, that is not counted. But marks will be there for everything. Marks will be there for everything. Word count only from the first paragraph to the 5th paragraph, first sentence. The second sentence will not be. In case any additional information is required, please do not hesitate. No counting. These words will not count. But 5th paragraph, first sentence will be counted. First paragraph, second paragraph, third paragraph, 4th paragraph, 5th paragraph, first sentence. But the last sentence, if you require any additional information, do not hesitate to contact me. That sentence will not be counted. So all these paragraphs, 4 paragraphs for the last paragraph, sans last sentence should be 180 to 200 between. Understood? Should be between 180 and 200. That's it. Others will not be counted, but don't think that they are not in word count, so it will not be there for marks. Marks will be there for everything. Word count only this body. That's it. Okay, remember that. So In case any additional information is deemed extremely prominent, in case, comma, any additional information is deemed extremely prominent, comma, please do not hesitate to contact me. Quality enhanced. Yes. So this girl Regina is there. Yeah, Regina is there. I'll give you admission. Yeah. And Utah, this is your last session, demo session. Okay. This is your last demo session. Okay. If you want to attend further sessions, you have to register. Because you are coming and I'm giving. But these sessions are for the regular students because I struggle a lot. I struggle a lot to give my dear children, okay, who are in my house, who pay for these sessions. Okay. But sometimes I'll give so that I'll think that you people will come and join. You want these sessions, so I'll give you free sessions. But you have to decide as early as possible. Okay. So this is the last session for me. Don't, okay, repeat request. No problem. But if you want to attend regular sessions and you want to pass in the first attempt, or with me, you want to get success, you can register. Because I don't say no to anybody who come and request. But sometimes, okay, I have to be taking a decision. So I have taken a decision. I have given so far. This is the last session for you. And then Regina, unmute. I appreciate you. I told you, if you are there till the end, I'll give you admission. Yeah. Regina, I'm giving you admission. If you are, I'm not asking you to join. I'm not asking you to join. But if you are impressed, if you are interested, yeah, you can request me. I'll give you my number now. Okay.
Okay, then I think give me your number. I'll
Yeah,
call
that's what I'm saying. So many people, even Dr. Ban Bakir also joined like that. She's a doctor. Okay. Dr. Ban Bakir is a doctor. Okay, 1 second. So Ban Bakir, get ready to say something, how you joined my classes, how you, okay, 1 second, 1 second. So contact the admin. Yeah, copy link. Yes. Yeah, this is my link. So there's my WhatsApp number. You can contact. Now, 2 doctors will tell you. Okay, one is a Dr. Ban Bakir. Then another one is Dr. Syed Farhan. He forgot his lunch also. I'm sorry, Dr. Syed Farhan. You only made me start the class. When somebody requests me, sir, I want something. When I need something means you deserve all these things. So that's why I gave you. It comes from the depth of my heart. So I don't know. I'm uncontrollable for that one. So I think you are happy for these things. No problem. Right. So Dr. Ban Bakir, unmute. Share your experience, how you joined, because she is there from the beginning to the ending. We have 2 more places. So maybe your recommendation will make her decide.
Good morning, everybody.
1 minute. Introduce yourself first, who you are. Everything, then afterwards tell.
Okay, I'm Dr. Ban Bakir. I'm from Canada. I joined the class like by Googling in the YouTube, and I found Simon Peter giving classes. So I just joined a free class, and in the same day, I made a decision and I joined his further classes. He helped me a lot in the time of the payment, and I find it very beneficial.
Yeah, can you tell me where are you originally from?
I'm originally Iraqi, and I'm Canadian citizen now.
Okay. She is a doctor. I don't mind. She's a small child for me. I treat her as a little girl.
Thank you.
Very obedient. She told me that she's just a little younger to me.
I told her I'm 54. Then she said, I am a little younger to you, sir. No problem. She told. So you can understand. But whatever, she's a doctor, she's how I don't mind. But she is like a small child. I treat everyone like that only. Okay, that's what it is. So that is Dr. Ban Bakir. And then now we have Dr. Syed Farhan Ahmed, a very big name. Okay.
Yeah.
Yeah, share your experience. And do you want to recommend Simon sir to this person? You tell me, please.
Yes, sir. I would really
Why?
recommend.
You introduce yourself first.
Good afternoon. My name is Syed Farhan Ahmed. I am originally from India, currently residing in Qatar.
How did you come to
Actually,
know about me?
I came to know about sir through my college senior, Dr. Ibrahim, who was sir's old student.
2 years
Through
back.
him, yeah,
Two
2
and
years
a half
back,
years back.
two
Two
and a
and
half
a
years
half
back.
years back. And
Yes,
he
sir.
sent me 5 to 6 students by now.
Yes, sir.
Continue.
Yeah, through that I got to know him. Then I spoke with sir, and then I was, satisfied that I can join his class. So yeah, and I'm seeing the results also. So it's useful.
Yeah. What time? I think you might have thought that maybe 2-3 hours classes will be there, right? But sir is
Yeah.
unlimited edition, correct?
Yes, sir. Yes, sir.
Sir is unlimited edition.
Yes, sir.
Normally students have time and teachers don't have time. But here it is
Mhm.
reverse. Simon sir has lot of time, students don't have time. Got it?
Yeah.
Mhm.
Mm. Mm.
Yes. So what time we started actually? I don't remember.
Sir, according to Qatar time, we started 7:30.
7:30. And what is the time now?
Now it is now it's 1:30, sir.
1:30. So how many hours already?
39, 30, 11, 13, 6 hours.
6 hours class.
Mhm.
The lecture went for 6 hours. So I think you got benefit. No, lot of information you got, right?
Yes, sir. Yes, sir. Yes, sir.
You are not going to study OET for 1 year, right? There are many students and many institutes providing 1 year course fees. One
Yes, sir.
student
Yes, sir.
called me and said, sir, they said 15,000 unlimited. Oh my God,
Yes,
you
sir.
want to study for unlimited? That means when you will do OET, when you will go for exam, I'm giving
Yes, sir.
same fees. I'm giving so much lectures. Who is bothered about like this? So you can finish it early. I told you. Yes or no?
Yes, sir. Yes, sir.
So now you are happy you got this lecture, or you want me to limit to 1 hour or 2 hours?
I'm satisfied, sir. Satisfied.
If you limit, if you want me to 1 hour, 2 hours, or half an hour, then you will learn for 6 months. Correct?
Yes, sir. Yes, sir. Yes, sir.
Yes. So that's it. So now, Regina, it is your time to decide. I gave you time. Okay. You attended the session. You impressed me. I felt happy. I'll give you admission. Definitely. So let me have your details afterwards. I have 2 places only. I don't give admission just that. I select them. Okay. And I'll test them whether they can endure the intensity of the classes. Then only I'll give. Otherwise, I'll not give. So that's it. But once you pass, once you study with me, you will definitely pass. Only the thing is, you have to be dedicated. Okay. Right. So, Ban Bakir Raham, you did not miss anything. I'll give you, don't worry, I'll give you the link. Actually, the live action you will miss, but you can watch it afterwards. Okay. You'll watch it afterwards. Yeah. Yeah. Welcome, Regina. So, what is your profession? You can write there. Okay. Reggie. Yeah, you are fine. Right. I got your message. I'll follow it up with you. So, any doubts you have, I am unmuting everyone. I am unmuting everyone. There is this unmute option. Unmute option here. Unmute option, mute all. Unmute. Yeah. Anybody has any doubts? Ban Bakir. Yeah, this is not everything. You can unmute, dear.
Hi, good morning again.
Good morning.
Because
Yeah.
it's very early time now for me.
Okay.
So I missed a lot. It means I didn't know that your lecture has started like 6 hours back. Like it was just midnight for me. I didn't know. So if you just tell me the timings, sir, because
No, I did not want you to. You already told me in the morning that you are going to sleep. I know. So what you
yeah,
can do is today you missed this one. No, you can tell me, sir, after 2 days or tomorrow or tonight, you can tell me, sir, can you give me that lecture? I'll give you again when another set of people will come and join. That if
okay,
we can
okay,
conduct
so,
in the evening or night, we'll conduct.
okay, okay. Thank you.
No
So
need to
you're
worry. You will not miss. You are a sweet little darling for me, small child for me. I told you. Okay.
thank you,
You are a
thank you.
6-month-old baby for me. You ask
No,
me. You're my child. No? You pay the fees, right? Are you coming for free sessions? No.
no, thank you, sir.
You
I
have the
appreciate.
right. Today I took this lecture because that this boy, what is his name? Not boy, doctor. I call like that only. What to do? Dr. Syed Farhan said, sir, I will take the lecture for writing. He said, so I gave. That's it. I don't know when somebody touches my heart. Why don't you tap my heart? Finished. Nobody is different. Everyone is there. You did not miss anything and you will not miss anything. You ask me. I'll get it another day. Right?
Okay,
Another
okay.
day. You can ask tonight. Your
Tonight,
night, your daytime, you can ask me. Or tonight it will be there after our night class. Or
okay.
tomorrow you can ask me. Give
And
me
the
some
night,
time.
you're gonna repeat it in the night class today, sir?
Today, already I took 6 hours. And again, 6 hours today is difficult. That's the point. Okay. So maybe tomorrow we'll do it. Okay.
Oh,
Today night I will take one particular class. Okay. One
okay.
particular
Can
writing task I'll explain. All these things will be repeated there. Okay.
and the night class tonight?
Yes, in the night class. I'm going to take
Oh,
that will be 11 o'clock night. Here, India, 11 o'clock night. 8 o'clock will
okay.
be normal class. That is reading. 8 o'clock will be reading
Oh,
class. After
okay.
reading class finishes, maybe 11 o'clock or 12 o'clock, that time I will take. Okay.
Okay, that's awesome.
Right?
So we will have a great night.
Yeah, no problem, no problem, no problem. Wonderful. Yes. So that's it.
Thank
Anybody
you.
is okay, right? Right. So that's it. And I have taken a personal session for Dr. Syed Farhan. Yeah, how was your class personal speaking session? Dr. Farhan, you did one warm-up session and you did one role play session. How was that? Can you explain to the other doctors and
Yeah,
nurses?
it was very informative. Got to know where I am lagging behind and where I have to improve, the areas where I have to improve. So yeah.
I'm
No.
giving you as a role model because you are ready to come and you are taking. No? So others
Yes.
also should come and take personal sessions like that. So if you tell them
Yes.
what is the benefit you are getting, they will come. Otherwise, they will simply sitting, cooking or sleeping.
Yes.
Okay.
Yes.
Most of
Yes, sir.
them are
Yes.
ladies. What to do? They have to cook, they have to wash, they have to clean, they have to do many things. We cannot help. So
Yes.
they have to knock me and ask personal classes. No, they are not asking. They are
Yes.
thinking, sir is taking 2 hours class, that is enough for us. No, personal classes are different. You have paid means you have to take attend, na? Right?
Yes. Yes.
So what is that
Yes.
personal classes? Tell them.
So personal classes are means like like what you do is you pick one session like reading or writing or listening, and then you discuss about it, and then you test also.
Yeah. Then afterwards, I'll give one role play card.
Yeah.
Speaking card, role play card,
Speaking.
weekly one warm-up session I'll give. Okay,
Yeah.
he is new student, na? So that way he's a little not, he's little shy like, he's a young boy, 25 years old. He's younger than my son. Okay, so, right. So what I'm telling you is warm-up session, weekly one warm-up session I'll conduct for everyone. And I'll train you how you have to speak, what you have to do, how you have to improve and all these things. I'll give you sentences. Okay, everything I'll give you and afterwards I'll correct your sentences. Warm-up session weekly once I'll give for everyone. So you can take that session. Next one is everyone I'll give you one role play every day who are regular students, not for others, for regular students. Okay, and I'll record that one and that audio I will convert it into word format. And I'll correct each and every line and word and sentence. And then I'll give you as a booklet. So that next you will not do those mistakes. At least once in a week, I'll give you like that correction. Regularly, I'll give normal correction. But first correction, and afterwards every week 1 day, I'll give special correction like that. Word to word, line to line. Because every day I cannot give like that. That's why. So weekly one. Whenever I conduct warm-up session, I'll give that one also. Other days, I'll give general oral corrections. Okay. So, and next thing is your video will be there on the YouTube. So you can look at that video and what mistakes you are doing. You can see the others' videos also. If I don't put, no, you will not get benefit. How Dr. Farhan has talked. So you can watch the video. You will get some insights from that one, or what mistakes he's doing. You will try to avoid those mistakes. What good things he is using, you can use those for yourself. So it can be like a model session for you, so that you can go read them and then you can prepare and you can come to me like that one. Then once you do weekly once or every day, I'll give you some sentences. I'll give you 12 C2 vocabulary. I'll give 12 C1 vocabulary, English language, and I'll give 12 C2 vocabulary, medical. Then I'll give you sentences. For all these sentences I'll give you. Okay, how to make sentences for that particular role play, I will give you. Yeah, we are going, Allah, we are doing that. Don't worry, we are doing. So next one is, that is individual. If you come to me, then I'll give you. Yeah, yesterday I was not well. Actually, I was little tired, yesterday, and I something rained and weather changed, and I became sick. Evening class I did not take. That's why I went and I just relaxed and I went to deep sleep and I got up at midnight, 1 o'clock. I don't know what happened to me yesterday. Sometimes it happens, but all my students know very well. Simon sir is fine. He will be online. If he's not online, he may be sleeping or maybe some emergency like that one. Everyone knows. So no, Simon sir is very hardworking. Everyone knows. Nobody will even bother me or call me or message me. That everyone knows about my seriousness. So that's what happened yesterday. So sorry for that. And then, yeah. So the sentences I will give you, and the sample models I will give you. Sample models I'll give you. So how you have to speak. Sample dialogues. Gold model, a silver model means 350 mark model. Gold model, no, bronze model is 350 marks. Gold model is 400, sorry, silver model, 400 band score. Gold model, 450 marks. Diamond model, 500 marks. Those model samples I'll give you. You can learn from them. Okay. Yeah. Right. It's lunchtime there. Okay. It is evening snacks time, 4:30. Okay. So, right. That's the end of the session. Have a nice day. See you all. Anybody has any doubts, you can raise your hands. Otherwise, I'm tired. Yeah, Syed Farhan, you can leave. Yeah. Anybody else? Any doubts you are there? Fine. So, Regina, you can call me on my WhatsApp. Yeah.